Good morning and welcome, everyone. I'm calling the 431st Council meeting to order. As a quick reminder, Council members, please have your video on during the meeting. We are live streaming this meeting through the Rcdso's YouTube channel so that members of the public, profession, and other stakeholders can observe our proceedings today. Today in this virtual space, we wish to acknowledge the land on which our college sits. For thousands of years, it has been the traditional land of the Huron, Wyandot, the Seneca, and most recently, the Mississaugas of the Credit River. But with many of us so far away from the Rcdso building, we invite you to reflect on the traditional lands in your area, which are home to many Indigenous people from across Turtle Island. We acknowledge and honor the ancestors on whose traditional lands we are today. We stand in solidarity with murdered and missing Indigenous women, girls, transgender, trans-identifying, and two-spirited people. Thank you. Our Registrar, Dan Faulkner, will now do the Council roll call. Dan?
Thank you, Hanno, and good morning, Council. I'll do the roll call in alphabetical order, starting with Nalan Bargava.
Present.
David Bishop. David Bishop.
Dan, I can see him waving.
I see David, yep.
Yes, sorry, I was on mute here.
Thank you, David. Amelia Chan.
Here.
Ram Chopra.
Here.
Jamie Colliver.
Here.
Christina Cordero.
Present.
Peter Delane.
Here.
Nancy DeSanto.
Present.
Mark Eckler.
Present.
Ellie Fisher.
Here.
Vivian Hu.
Present.
Richard Hunter.
Here.
Benjamin Lynn.
Here.
David Mock.
Here.
Joseph Richards.
Present.
Harinder Sandhu.
Present.
Gildo Santos has sent his regrets. Brian Smith.
Here.
Osama Solomon. I believe Dr. Solomon was going to be a little bit late, so he is intending to be here. Rod Stapleforth.
Present.
Mark Trudell.
Present.
Sandy Venditti.
Present.
Jack Wasserman.
Here.
And Judy Wilikovich has sent late regrets. And Cam Whitmer.
Here.
Thank you. I'll turn it back to you, Hanno.
Thank you, Dan. I'd now like to ask Dr. Sandy Venditti to provide the President's remarks. Sandy?
So thank you, Hanno, and good morning, everyone. So as you can see from today's agenda, there is a lot of work going on at the college and in a number of different areas. So I will just highlight a few of these in my remarks. In terms of governance, we have made great strides. Considerable progress in relation to board development and other important elements like conflicts of interest and rules of engagement, which we'll discuss later today. As president, I feel very proud of how council has passionately embraced this work and the proactive steps we've taken together to be more effective directors in our oversight role. Governance is a process, and there is always more work to be done. I want to personally thank each and every council member for your commitment and dedication. Your preparedness and engagement in discussions is exactly what we need in order to continue to add value. Diverse perspectives always lead to better decision-making, so let's continue to respectfully challenge management and each other on behalf of the public that we serve. And as an organization, the college has always been very clear on our purpose. Our public interest mandate shapes and drives everything that we do. That's evident in our council materials and, importantly, the draft strategic plan that we will consider this morning. I'm excited about the new approach and the direction that it sets for the college. I look forward to your input and also in getting the thoughts and feedback from external stakeholders. The college has also purposely continued to build strong relationships with key stakeholders. Our next virtual Rcdso Connect meeting on June the 28th is an opportunity to engage with dentists across the province. We have an interesting agenda that will address topical issues, member questions, and center around how dentists can get involved in college work. Your package material also has an update on our engagement with a range of stakeholders related to access to care. Additionally, our work on COVID-19 has continued, and we are very pleased with the fruitful collaboration amongst the other oral health care colleges. This work will be ongoing as we navigate a changing public health landscape and consider alterations to our COVID-19 guidance. As always, none of this would be possible without the hardworking and dedicated staff of the college. Their efforts are evident in the materials that are before council today, and I want to publicly thank Dan, the senior leadership team, and every member of the Rcdso team for all that you do each and every day in making sure that the college effectively regulates dentistry in the public interest. Thank you for your enthusiasm, your drive, and inspiring new ideas and perspectives. We could not do this without you. I'd like to formally welcome 3 new leaders who have joined the college over the past several months. Leslie Byrne is our new Director of Communications. Susan Taylor is our new Director of Quality. And Danielle Rodet is our new Manager of the Facilities Inspection Program. So on behalf of council, we're pleased to have you with us and look forward to great things from you. Finally, I want to acknowledge the public. For those tuning in, thank you for joining us. I hope that in both the meeting materials and in our discussions today, you can see firsthand just how dedicated we all are to acting in the public interest and how diligently we work to ensure that the public is protected and continue to receive safe, high-quality care from Ontario dentists. So Hanno, I will turn it back to you. Thank you.
Thank you, Sandy. Next item on the agenda is declaration of conflict of interest. Before I ask members of council to declare any conflict of interest, I remind you that conflicts are important to declare because of our public interest mandate and is a standard reflected in the Ministry of Health College Performance Measurement Framework. Do any members of council have any conflict of interest for any of the topics that will be discussed today? Thank you. Seeing none, I'll move on to item 5 on the agenda, which is the consent agenda. Just a reminder to council, we're continuing to use a consent agenda as a time-saving mechanism. On the consent agenda are multiple items that are for council's information, and council will be asked to approve these in one motion. Council, you can, of course, ask any clarification questions about an item on the consent agenda, but if you wish to have a more fulsome conversation about an item, we will take it out of the consent agenda and address it later on in the meeting. As always, I'm asking council to please use a high threshold when asking to remove an item from the consent agenda. This is really just so we can manage our time effectively and make sure that we're reserving time for robust discussion on our decision items. The items contained in the consent agenda will be found in your meeting package, starting on page 2 and going to page 99. Before I ask council members if they have any clarification questions, I do want to offer 2 highlights. With respect to the minutes, we haven't received any typos or minor errors from council on the minutes, but we did note one minor administrative error. On page 18 of your package, a bulleted item was omitted. So lines 555 to 569 should read as follows. From the feedback received, the following 3 current strategic objectives were identified as areas that should be retained. Decision-making, supported by available data and evidence, college governance, and continuous quality improvement. Regarding the COVID update, there have been a few developments since the COVID briefing note was drafted. Dan will provide an update on COVID in his registrar's report. So with all that, I will ask does any council member have any declaration or clarification questions on any of the items in the consent agenda? And I would ask that you either raise your hand using the raise hand function or in chat, but I do see Peter Deline. I'm going to ask you. I see your hand is up right now.
Yeah, thank you, Mr. Chair. Question I had to do with item 5.10, the Office of the Fairness Commissioner. And I wanted to get a little idea what the implication to the college is, for this moderately low rating. What's the true implication here? And is our risk rating tied to the performance of the NDB in any way?
I'm going to turn that over to Dan, please.
Yeah, thank you, Hanno, and thank you, Peter, for the question. I think in very practical terms, there is very limited impact of that rating on the college and its activities and how we move forward. What it essentially, well, first, let me step back and say that it is a very new framework. It is the first year that the Office of the Fairness Commissioner has tried to apply a risk ranking to colleges based on all of the factors that you read about in the letter. We certainly had a number of comments to provide back to the Fairness Commissioner, and you saw that in the briefing materials we wrote. And we had a meeting with the Commissioner and his office staff and shared our concerns with how they came to a rating from the facts and the information before it. We won't get a change to that rating, but essentially what it will mean is there'll be a couple of touch base points with the college and with the Fairness Commissioner's office over the course of the year. And then hopefully what we'll see is a little bit more transparency and understanding by colleges in terms of how you use that information to leap to a ranking. I don't know where this is going for all of council. I don't know if this is going to eventually be more of an assessment type process for us, or what the ranking or the result will mean to colleges, but I'm not anticipating that there will be a lot of practical differences over the course of this year based on this first year of the ranking. And I would just say, I think the last part of your question related to the NDEB, it appears from everything that we saw in writing and heard from the commissioner and his staff that it is a future-oriented ranking based on what they want us to do with the NDEB. And I can share with council, and I'll share in September or December, depending on how quickly it moves. We have been having active discussions with the NDEB in terms of a memorandum of understanding, and we're making good progress. And so I will have an opportunity down the road to share that with council in terms of what that looks like and what sorts of expectations we might have with the NDEB in terms of their carrying out their part of the certification and licensure process.
Thank you, Dan. I am not seeing Jack, I see your hand is up next. Jack.
Great, thank you so much and good morning, everyone. This is regards to 5.7, the COVID-19 update. And in particular, there were three very knowledged infectious disease people who formed a panel who decided with their knowledge to not rescind the fallow times in the dental offices, and in fact to keep the doors closed. Generally speaking, dentistry is evidence-based, and I'm wondering what evidence was used for their decision-making here.
Dan, I'm going to punt that over to you, please.
So that might be something that we can address in my remarks. I did plan, Jack, to focus most of my remarks on the COVID-19 update because of the changing environment. And I'll come back to that question when we get there, if you are okay with that.
That's great, Dan. Thank you.
Okay, thank you for that, Jack, and thank you for that, Dan. I am not seeing any other hands up, so I would ask if the motion could be shared and put on the screen, please. The first motion of our meeting today. that the following items be approved and or received for information by council. And then there is the list. I would just ask you to glance down the list. I would look for a mover for that, please.
I move.
Moved by-
Second, Mr. Chair.
Okay, moved by Ram, seconded by Brian. All those in favor? Opposed? Abstentions? Thank you. That motion is carried. Thank you for that, Council. And now we will move on to the Registrar and CEO's remarks. Included in the consent agenda is a written report from Dan. That can be found on pages 26 to 29 in your material. So Dan, I'm turning it over to you now. Thank you.
Thank you, Hanno. And I have some slides that will appear momentarily. And I will also just ask Andrea and or Cameron Thompson if they can be prepared maybe to elaborate a little bit on Jack's question earlier about the information that was available to our panel, but we'll have some room for that towards the end of the remarks that I'll make. Thanks. If I could have the next slide. I want to just refer very briefly to a couple of things that were in my written remarks. And hopefully you've had a chance to read it. There's a lot of action at the college, a lot of activity, and a lot of really great work that all of staff are involved in every single day. You've seen the governance report that was provided to the Ontario College of Social Workers and Social Service Workers. It was prepared by Harry Caton, who I know you're familiar with, and Deanna Williams, who has been on the regulatory scene in Ontario and Canada and beyond for many years. And they provided a report that was requested by the College of Social Workers a few months ago, and that's a very interesting report. And it's provided just to continue to demonstrate to Council the landscape of governance in Ontario and Canada. And you can see a lot of very similar themes that emerged in that report that you have seen elsewhere. I want to mention quickly, I had written in my remarks that the vaccine policy that was created for Rcdso and applies to anyone who is going to be conducting business in person, and that would be in the building, or in the case of council potentially in September, if we're continuing on the path that we're on, would have to demonstrate their vaccination status for the safety of all of those who are involved, who are either staff or council committee members or others who work with the college. I want to just say that we are continuing to work on that policy. It's really hard to predict where we'll be in September, and I will get more information to council in terms of what, if anything, at that time will have to be produced. But we know that the landscape there is changing fairly rapidly, as well as we've heard of a number of companies now that are not requiring vaccination status. And we've been working very closely, obviously, with our Human Resources Department and our external employment lawyers. Very exciting news that will happen in the next month or so. You will see shortly a refreshed website. I believe it will be launched late next week. And this is a long effort by many people, and our communication staff has done an incredible job of really looking at the website and modernizing it, and really looking at how the content is much more accessible to the public and to the profession. And we will obviously take feedback in its early days, but I hope that you'll be as excited as I am about what the website looks like and how it reflects on the Rcdso and the work that we're doing. And we'll have our 2021 annual report that will be released in the next month or so. We'll talk later today about committee reports and a lot of the information that was provided through committees, and a lot of the work that's happened at the college that's outside of the committees that will be shared with the public and the profession, so that they have a glimpse into what we're doing and what we're trying to become with our strategic vision. Sandy had already welcomed 3 new staff. I would reiterate that welcome. In order of their arrival at the college over the last couple of months: Danielle Rodet in FIP, Susan Taylor in Quality, and Leslie Byrne in Communications. And already we're seeing some really great work and perspectives that those three individuals are able to provide to their respective roles and the college work in general. And finally, I just want to share, as I have been over the last few meetings, if you could turn to the next slide, the three quick slides that I show, and we are continuing to build on the kinds of key performance indicators that you should see as a council in terms of our accountability for moving this college forward. You can see here that there are a number of strategic projects that are still ongoing and in progress, 18. You can find on pages 88 to 98 of the materials a much more detailed description of all of those projects. And so I will just leave it at that. If you have any questions, we'll certainly have people who can answer those. Next slide. And the dashboard that deals with our investigations area. And this focuses on the different types of complaints and open files. And I would draw your attention to the percentage decrease in open files. Just a tremendous amount of collaborative work with our leadership in PCRA, our staff, all of our staff, the committees who meet as panels have just really worked hard together over the last year to address the timeline and the backlog issues. And we have been able to see a decrease of open files of 18% since January of this year, and a decrease since October of last year, so about 10 months or so, or 8 months, of 27%. So lots more work to do, but just an incredible effort and an incredible result in this short period of time. And the next slide really focuses on a much more visual display of those case files by year and how they are dramatically being reduced. I would draw your attention to the bottom 3 lines, where we have almost completed all but 5 cases that started or were opened in 2017, 2018, and 2019. An incredible amount of effort to decrease that by 96% in the last year, or less than a year. And you can see naturally that the 2020 cases in blue are coming down very quickly. And the cases that were opened in 2021 obviously would rise as the year went on. And now that we're into 2022, we can see that reduction. And 2022, the red line is going up, as you could well expect, based on the fact that we're still in this year. So again, amazing results, and we will continue to demonstrate our progress. And at some point, we'll reach a point of equilibrium where we will not have to provide this, because you will hopefully be confident that we have this case inflow and outflow well under control. Next slide. So I want to turn now to a little bit more detail on COVID-19. And this has obviously been an issue that has been in all of our lives for the last 2.5 years. It has been part of our Rcdso's environment and the practice of dentistry. And of late, with improvements that we're seeing in the environment, we are certainly hearing from lots of members of the profession and others about the COVID-19 guidance document that the college has had since the spring of 2020. So I want to give you a little bit of context, and then to talk about the 2 key issues of fallow time and closed operatories. What we know, and again, this is context that many of you know, but I just want to make sure that we're all on the same playing field. Dental practices, most practices are surgical in nature. The profession is a surgical profession. Many procedures generate aerosols where viruses can be transmitted. And the nature of the practice itself requires that care be provided to patients who are unmasked, generally, in rooms where previous patients have been unmasked and having treatment. The guidance document itself uses a couple of phrases that I just want to point you to. First of all, that the guidance will be informed by current best practices and best available evidence, and where professional consensus is lacking or the available evidence is unclear, the guidance takes a precautionary approach that prioritizes the safety and well-being of patients, staff, the broader public, and dentists. And those are 2 principles that have really guided our work to date. And obviously, there are many ways to interpret them. They were written back in the spring of 2020, when we certainly needed to act fast as a college, and there was very little known about COVID-19, and a lot more has been learned. But it's a really important anchor for the document and for the guidance and how we've moved forward. Next slide. Some more context. Obviously, you know, we've had over the 2.5 years, often incomplete and changing evidence on a weekly, monthly basis. And we have used precautionary principles where when there is scientific uncertainty, there has been a more cautious approach in our use of the guidance. We have a very detailed guidance document, and for very good reasons. Back in 2020, we wanted to make sure the profession had as much information to help them manage this situation, and it was always designed to augment a very robust infection prevention and control standards that we have. We've seen multiple amendments, as you know, to this guidance document in 2.5 years, and certainly since I arrived in August 2020. And it's been related to many different types of changes. The nature of the virus and variants has changed. What we understood about transmission, what we understood about how serious illness, hospitalizations, and deaths can result from the virus. Regional variations. You may or may not recall that we had a period of time where we had colors, and they were applied to public health regions. We have vaccinations that have come on the scene, testing accessibility that has been cyclical in terms of whether it's available to the public or not. And there have been multiple versions of provincial restrictions and chief medical officer of health directives. And all of those, we've tried to very actively understand what is changing, what's being said, what the directives are, and provide our best. And when I say our, we have always gone to the executive committee to make sure that we're on the right track and we're using the best information that we have to make decisions. Another really important context, and I've placed significant importance on this, is how we work with our partners, the other oral health regulators, dental hygiene, denturists, and dental technologists. When we developed the first principles and guidance in the spring of 2020, there was a collaborative effort to do so. We still ended up with guidance that was somewhat different between the colleges, but there was a very concerted effort to make sure that the 4 colleges were working together. When we heard lots of pushback in terms of the differences in the guidance, we worked hard to come out with a unified guidance document for all 4 professions in July of 2021, and we continue to work with each other. I meet with the registrars every couple of months, and we have a staff working group that's looking at the COVID guidance document quite regularly. And I want to also point to public trust, and this is not evidence, it's anecdote, but I follow social media, and I've seen over the last 1.5 years since I've been here, different conversations that have happened where the public is talking about the confidence that they have in dental practices, attributing it to what the dental profession has done with their practices to make sure that patients and staff are safe. So that's a very important element. And all of this being said to say we balance, attempt to balance all of these issues as we move forward. Next slide. So let me turn now to the 2 issues that have created the most conversation over the last few months, fallow time and enclosed operatories. It's fair to say that there has been variation in jurisdictional approaches across Canada since day 1 of the pandemic. We know that in British Columbia, they did not have requirements or recommendations for fallow time or enclosed operatories. They relied on their IPAC standards. They relied on the clinical judgment and professional judgment of members of the profession. We also know that other jurisdictions did have such requirements, such as Quebec. We know that there is incomplete and little evidence. It's changing, but again, I would say at this point, there's still very little evidence that fallow time is achieving what it was intended to achieve. And there have been many different expectations that we've tried to anchor to. We have looked regularly at Public Health Ontario guidance. We've looked regularly for some of the fallow time details around air change times for removal or settling of aerosols from the Center for Disease Control and Prevention in the US. We have tried to gather as much evidence, if it exists, and information as possible. We also know that Public Health Ontario plays a very prominent role in what we do and what we decide. And to date, on the books is a letter from September 2020 to both the Dean of the University of Toronto and myself that said the Public Health Ontario was not changing its position on enclosed operatories. It also had a document out recently that said it addressed fallow time, that it would not recommend a fallow time approach in any healthcare setting. And upon further conversation with Public Health Ontario, we learned that it was not intended to apply to dental practices because the document itself, if you recall, the context was about PPE and healthcare professionals. So the recommendation was related to cleaning of facilities, and that any member who was properly gowned and masked, any member of a healthcare profession properly gowned and masked could go into that operatory where a dental patient had been and clean it. But they had not contemplated in that guidance unmasked patients coming in for procedure. So I'm not suggesting that there was evidence to keep it, but it was not necessarily the intention around dental practices within that document. So still, just to state very clearly, a lot of uncertainty and really trying to navigate a very tricky area in terms of what experts are saying and what practice is like on the ground. And it's had an impact, I think in some cases minimal, in some cases profound, on the faculties of dentistry in terms of the limits of training, in terms of vulnerable populations that they treat as part of their training programs, where they've had to decrease the number of visits because they have huge open spaces for their operatories. It's also had an impact on dental practices in both the hospital and community. So we're not blind to that in terms of the work that's going on. We recognize that there has been a number of different ways in which these recommendations have impacted practice. Next slide. So just to close out, what have we done and where are we going? There has been a lot of work from March 2020 to right up to today. And I've used March 2020 to November 2021 just to give a very general statement, because there were many ways in which we developed early on the guidance, and we had regular amendments. When we had provincial representatives stand up with press conferences, we had multiple times during that period where we had to wait for the written documentation, and we had to decipher it, and we had to translate that into any amendments to the guidance. In November of 2021, we started to meet with faculty representatives. And as we got into December, and we were going to go to a group of infectious disease experts, we were sidelined by the Omicron variant. We were seeing some significant increases in infection rates. And as I've paraphrased here, one or more of our experts said, it would probably be the wrong time and the wrong public message to reduce precautions at this time. And so we stood back and waited, and we got into the spring. And all this time, we've been working with our counterparts at the other colleges. In late April, early May, we met with infectious disease experts, and this, Jack, was what you referenced earlier, where that group came together with profession representatives from the 4 colleges, so dentists and denturists and dental hygienists and dental technologists, and also representatives from our staff came together and discussed what was available. And I know generally what they talked about. They talked about the environment. We had at least one member of that expert team who is familiar with IPAC in dental practices. We had Dr. Allison from McGill, who is on faculty in the dental school. So we did have some of that representation. They looked at evidence that was available. They looked at context, and they recommended, and I think just to clarify one of your statements, Jack, they did not decide, they recommended. And as staff, we pulled that together and talked to executive committee and agreed to continue at this point, or at that point in mid-May, with the fallow time and closed operatory recommendations based on what that group had looked at. And the oral health colleges, as you know by now, prepared a joint statement, and that was issued to the profession on June the 6th. Next slide. So what I want to just mention now is that we have, as I think I've said a couple of times, a very detailed COVID guidance document that includes not only fallow time and closed operatory statements, but many other things that are likely too detailed at this point in time at the pandemic. We have seen in the environment, and this is where, yes, we were seeing some reductions in early May when our expert panel first met, but since early May, we have seen significant reductions in hospitalizations and ICU admissions. and the level of illness from COVID or that wave of COVID. We know that the dental regulator in Quebec now has removed recently requirements or suggestions for fallow time and closed operatories. And we want to continue to move along together with the other oral health colleges. And we are. And we've been talking regularly over the last few weeks. Many changes took place just this last weekend. If I could have the next slide. On June the 11th, we knew the directives were going to change. We also had the ministry or branches of government that have stopped with their daily push of a dashboard or their data. They're no longer providing that to all stakeholders by email every day, which I've received since the day I arrived. They've now posted everything on a website. And I think what they're trying to do is manage in the environment COVID versus treating it as something different now. And so mask mandates have changed, and they've come out with, if you could just click again, they've come out with guidance documents from the ministry that are relying a lot on the IPAC recommendations from Public Health Ontario. And we've linked to that recently in our communications e-blast. Next slide. And so where are we going with all of this? So there are two streams that are happening right now. They're happening concurrently. The first on the left is we realize we're at a point where we need to significantly pare down the guidance document. It includes things like how to don and doff scrubs or your attire for the day in the practice. It includes a number of things that are probably much too detailed at this point and don't align with the recent directives and PHO guidance that we've seen. So there is work happening now, which we are targeting for the end of June, to be able to pare down significantly the current guidance document. And this won't address fallow or closed operatories at this time, but I'll get to that in a moment. So what we see is by the, probably within the next 9 to 10 days, meeting with our executive committee with the revised document, which if approved would go out to the profession, and we'll also continue to communicate about where we're going with the fallow time and the closed operatories piece. So I turn your attention now to the right of the slide on the right. And we are also looking to do I would say a fairly condensed review, which will involve not only the experts that we have involved previously. We have also involved or will involve the two schools, and we've been in conversations with, I've been in conversations with the two deans, and we have a couple of other representatives who have been working with us. We will involve British Columbia to really try to understand how they came to their decision not to ever have fallow time or enclosed operatories. And we will involve Quebec so that we understand their rationale for removing it. And we will do a number of other things to gather this information and bring it back to our executive. And we're targeting sometime in late July, hopefully. So we'll be able to address that issue, not only with those experts, but also context and current practice and practical experiments that have been going on over the last 2 years or more in this area. So we are really trying to not only bring appropriate information to make an informed decision, but to do that very quickly. And I think in the normal course of consulting on policies or standards, I hope you will agree that this is a very, very condensed process to get to a point where we can make an informed decision and share that with the public and the profession. Next slide. And finally, just to reiterate, but we've been trying to, with Leslie on board, to really have regular communications with the profession. So we've had e-blasts on June 6th and June 14th. We will continue with that. We will have post-council highlights that will hopefully go out in the next couple of days after this meeting. So we can describe the process that we're using. We will use social media and we'll monitor for the conversations that are happening. And we already have and will continue to have strong communication with the faculties, the ODA, and with the other oral health regulators, and work with them as we move forward. So thank you very much. I think the next slide is just a question slide. We can stop sharing the screen, and I'm very pleased to take any questions about the COVID-19 issue or about any parts of the written report that I provided. Thank you. Back to you, Hanno.
Okay, thank you very much for those fulsome comments. Dan, I would ask, I do see Osama's hand is up, and I'm going to call on you in a minute, Osama. I would ask council, though, to either use the raise hand function or to put it in chat, because that then pops up and it's easier for me to monitor. So I am going to ask you first, Osama, because I did see your hand up.
Hey, everyone. So Dan, that was a great document, buddy. It really highlighted some of those concerns that obviously we've been trying to look into over the last couple of years, and it's tough to actually really figure out which direction to go to. So that was a good document. I think that the two things that are really good about the document are obviously the collaborative effort and really bringing in the other colleges to have one voice in terms of which direction to move, which is awesome. The second thing, which I think would be very useful, and I really look forward to it, and many of us for the upcoming document is really the pros and cons in terms of what BC's vision is and Quebec, and how that relates to how and what we do in terms of how we modify things in Ontario. The two things that I think need to be highlighted in the next document, which I think are missing in this document, are first the implications in terms of access to care, because I think it's really affecting, and you touched on it briefly, but I think it's not highlighted enough. We need to make sure that we discuss the role of fallow times and closed doors in terms of how many patients are being seen in dental offices, not only in the faculty of dentistry, but also in practices. And in particular, it does affect the specialty offices and the general practices, especially in hygiene and the number of patients they can see. And so the backlog is starting to become very significant in dental offices. The second thing, which I think is very important, is I look at the experts that were consulted, and I understand having infectious disease, but no offense to the infectious disease doctors, and many of my friends are infectious disease doctors. They don't quite understand what we do as dentists, frankly, and I think we have to be. I think that it's great in the next document to bring in the faculty of dentistry, but I also believe it's very important to bring in members who are actually practicing in the community, in different parts of the communities, so that they can have a representative voice of what's actually happening in the offices. And I think that will really give, it will shed light in terms of what's happening on the ground. So I think those two things are very important for the next document. But thank you. Yeah.
Thank you. Next on my list is Jamie.
Yeah, thank you, Dan, for that report. In the consultation process, is there a public advocacy input, beyond what you read on social media? Do we request the public's feedback with regard to, dental practices in general? Let's call it that. Is there a dental advocacy for patients? Thank you.
So if I could, Hanno, to respond. So I think generally, Jamie, there's been a lot of work that's happening with things like a citizens advisory group that the colleges, the 26 colleges across Ontario, have access to and are using. And now Rcdso is a member of that group, where we have access to a citizens group that is very diverse in its makeup. They're becoming more knowledgeable about the regulatory environment. And so a number of topics are being brought to that group. It's a very good question, because we did have conversations internally about, whether we wanted to go to the public, whether this would be a very technical issue, whether we wanted to know about general trust and confidence in the dental profession. So we didn't do it. We have relied really on trying to understand what the public's saying out there, as I mentioned earlier, and also the public representation here on council and on the executive committee that they bring to the table on every issue. But it's a very good point, and I know, and to Osama as well, our team is taking notes of your comments, and we're certainly going to look at a number of these things as we go forward, and how we fit them into the kind of timeline that we need as well to address this issue.
Thank you. I'm not seeing any other hands up. So Dan, thank you again for that very comprehensive report, and council for the questions and the conversation that we've had. I would like to move on to item number 7 on the agenda now, which is the Rcdso draft strategic plan. It's going to be the first decision item of the day. The materials for that plan are on pages 100 to 116 of your meeting package. This item is for council's decision. Andrea will be providing council with a presentation on the draft strategic plan. The question before council will be whether council supports the draft being circulated for external consultation with the public, the profession, and key stakeholders. So Andrea, I'm going to turn it over to you now, please.
Great, thank you, Hanno, and good morning, everyone. So I'm really going to take you through a few slides today, this morning, to touch on a bit of a recap of our stakeholder consultation that we did earlier this year, and all of you participated in. Take you through some highlights of the draft plan that's in your materials, and then talk a little bit about what's next. So this just lays out for you, the thinking and strategy around the consultation. As you know, we went out with an early consultation. Normally we consult on a draft document. This time we went out early to get ideas on concepts and direction. And so, this sets out the full spectrum. I would say, since we last saw you in March, we've really been focused on items 5 and 6. We've been analyzing all of the feedback and really thinking about how to translate that into a draft document, which we have for you today. These are the groups that we consulted, and you can see we really have tried to cast as broad a net as we can. We wanted to hear from what we've categorized as internal stakeholders. That includes all of you, along with staff and our executive committee, but also a whole host of external stakeholders. So really, we sent the document out, we posted it online. It was open to really any interested party. This just gives you a sense of the timeline, what we've been up to. This work started in January with our consultation efforts. And the last milestone that we had with you was the March meeting, where we had the breakout sessions. We got some really great feedback from you. And as I mentioned a couple slides ago, since March, we have been focusing on analyzing all of the feedback and putting together a draft plan for your input. So in terms of the consultation, in your package, you have a comprehensive report. I'm not going to go over every detail. I'm really just going to pull out a couple of the highlights so that you can be refreshed as to what did we really anchor to when we were preparing the draft plan. So 3 key recommendations. This notion that the next draft plan, strat plan rather, should really be pared down in terms of objectives, that no more than 3. That, of course, the objectives have to be anchored to the Rcdso's mandate to protect and serve the public interest. And, many of you, including many of you on council, really liked a lot of the objectives we had in the current plan. We have 7 currently. And the idea was, let's try not to lose anything. Let's try to see if we can still keep focused on those things for work, but really streamline how we're tackling them, have much more focused objectives. These were the objectives that stakeholders really pointed to that could be reformulated, could be carried over, but really collapsed into other objectives. People were seeing relationships between them and opportunities for us to condense them into sort of broader objectives. There were some that stakeholders recommended become enablers. And what do I mean by enablers? We'll talk about that a little bit further when I go through the draft plan. But really, it is the notion that these things, decision-making based on evidence, continuous quality improvement, risk-based approach, those aren't going away. They are just now going to become part of how we work. They're going to be embedded in every single thing we do. It's part of the implementation of any work we're going to do. So that feedback led us to developing a draft strategic plan. You have that in your package. First and foremost, there's a different look and feel, and you'll notice even in our PowerPoint presentations, our communications department have really rebranded the templates and the color palette. So it's going to look a bit different and more refreshed and modern. But the substance of it has also changed slightly. And I'll go through each of those elements. Starting with the vision, just here, a compare and contrast, you can see they're virtually identical. The main change here is instead of anchoring only to dentistry, we have swapped in oral healthcare to really acknowledge dentistry's role in that broader oral healthcare landscape. With respect to mission, again, a compare and contrast here. Our objective in proposing this edit was not to lose any of this content, but really pare it down, be much more efficient in our language, focus on the things that really are essential. So not a substantive change here in terms of positioning, but really working with language to trim it down a bit. The values have remained the same. We have not proposed amendments to those. So you can see them here on screen. And we really felt that those remained just as valid and accurate today as they did when we developed the first plan back in 2019. In terms of the pillars, so what we're calling pillars, these are sort of 3 areas of focus that have served as anchor points to the actual substance of the plan. And here I'm just going to illustrate to you how they connect back to some feedback we received. So, you can see here, and many of you have said this to us, that, there have been different models of practice and focuses of practice. And so there's a sentiment amongst some that this has been a threat to patient-centered approach, patient-centered care. Some other sentiments in that category of professionalism are here. Many of these came out of our discussion with you in March and those small group breakout sessions. Professionalism was a really consistent theme we heard from you. In terms of stakeholder engagement, this is something that we have represented in our current plan. And ongoing interest in really looking and thinking about the relationships the college has with a whole host of different audiences and stakeholders and communities. And so here's some of the things that we heard, and you can see here a really broad spectrum of what engagement could look like. Finally, emerging issues. I mean, of course, COVID-19 is an easy one to point to. This is really intended to capture, just as it sounds, those things that are on the horizon that either other stakeholders are developing that we need to respond to. So governance change is a good example of that, or things that we're anticipating that we want to be proactive in looking at and addressing. And again, here are some examples of things that we heard from stakeholders. So how did that translate into the proposed content? So what we did, based on those themes, we thought, okay, let's have 3 anchor points, these pillars: professionalism, engagement, emerging issues, and then proposing to anchor an objective and then areas of focus to each. So I'll just take you through that. So the first objective here, about Rcdso promoting a culture of professionalism, really supporting quality care, public interest, public trust. These are, and I'll just say for a second, these are intended to be very high level. I'll talk in a second about where the detail comes in, but we did want to include this other sort of box, and you can see it in the draft plan as well. Areas of focus. These aren't meant to be an exhaustive list of the work that we're going to do, but really more illustrative, so that if readers were sort of wondering, okay, well, what's involved in promoting a culture of professionalism? What might that look like? What's the specific work? We wanted to give a couple of examples so that those connections were made. Same approach with stakeholder engagement. So again, a high-level objective here, enhancing collaboration and engagement with the public, the profession, system partners, advancing patient-centered oral health care, and regulatory excellence. So really a broad range of types of engagement, purposes for engagement. And you can see that reflected here in the areas of focus, these examples, a whole host of different types of engagement for different types of purposes. Lastly, in terms of emerging issues, just like I said a minute ago, this is really meant to capture the language we had used in the current plan was disruptors. And the sentiment was, that may feel a little bit negative, that something's happening to us that we just have to react to. And the proposal here is that obviously we want to still do that. That's necessary. We need to be responding to things in the environment, but that we also need to be proactive. And really anticipate what's coming down the pipes. And again, you can see here in the examples, there's a whole host of things that either we're dealing with currently or that we anticipate we will be dealing with. So that's intended to be captured here. And then really to speak about what I referred to as enablers, we really wanted to include in the draft plan a notion that these three elements are really going to underpin all that we do. And originally in earlier drafts, we thought about, well, should they belong in specific pillars or objectives? But we realized, the proposal, at least, I'm interested in your feedback, is we really think they cut across so much, if not all of the work that we're proposing to do. So we wanted to make a commitment that the college is going to just be informed. This is how we're going to work. We're going to keep all of these three things and commitments in mind. And again, so here's just those key enablers. We really think this is reflective of what we heard from you, but also just how we're working now. And just to pause briefly on the equity, diversity, and inclusion, you'll know that the college has been working with the Canadian Centre for Diversity and Inclusion. We have an action plan. There's more work to do, and we wanted to keep that really focused in the plan. This is just a visual to illustrate for you, to go back to what I had said earlier, the feedback that, see if you can reformulate existing objectives so that we don't lose them altogether, but we maybe, bring them in a more focused way. So this is just a visual to show you how we've attempted to do that. So starting at the top of the slide, on the left-hand column, you have the objectives, as you can see in the current strat plan. And then on the left, how those have been translated into the proposed objectives in the draft 2023-2025 plan. So governance and disruptors now really captured in emerging issues and that objective. Access to care, of course, retained, coming under the objective for professionalism. Engagement and supporting staff really coming in under the objective for stakeholder engagement. So in terms of further detail, the strategic plan is really intended, as I said a little bit ago, to be very high level. That doesn't mean detail won't exist. We will have an action plan that will help us really think about how to implement the plan. And that's where we're going to be able to set out your priorities, specific projects, and so on. And, the action plan doesn't stand alone. We also have a number of other tactics and tools that we use, project planning, templates, all kinds of things that happen behind the scenes at the staff level to help keep us focused and organized and make sure that we're moving ahead on things and can demonstrate progress to you. So just to say, the action plan is going to be developed over the summer. We're trying to stagger it. We wanted to get first-year feedback on the strategic plan. If you're agreeable, send that out for consultation. And while we're getting feedback on that, start putting together a draft action plan so that we can try to be as organized as possible for when we bring this back to you in September. So speaking of that, next steps. We're asking you today for your approval to consult externally with stakeholders, and I should say internally as well. We're intending to also consult with staff. All of you will be included, of course, but capture the external stakeholders as well. And then the idea is over the summer, we will do that. We will tabulate all of the feedback and come back to you in September with a draft strategic plan that incorporates any revisions that will flow from stakeholder feedback. So we'd come back to you with those proposals, highlight for you what revisions we're proposing based on feedback, and get your final approval of the plan. So questions for you today. Of course, we want your comments. We want your feedback. This is the actual decision item and motion that will come up in a moment. With that, Hanno, I'm going to stop sharing, and then I will turn it back to you to just manage any questions that council has.
Thank you very much for that, Andrea. And I do see Osama, you have put your hand up. So Osama, I'm going to ask you first, please.
Yep. Thank you, Andrea, for that. That was really cool. I really like the three pillars there. That's awesome. The professionalism, engaging the stakeholders, and any emerging issues. And not to get into too many details, but I would love to see some potential, basically to address two things from the emerging issues realm. The first thing is what I didn't see IT on there, and I think that's a big one. Coming forward with a lot of questions around what do practices and patient files have to do in terms of cloud-based management and risks to practices from that standpoint. I think that might be the upcoming or potential emerging issue for dental practices in terms of how to manage that. And I think when a lot of members contact the Rcdso, there's a robust response in terms of what the cloud-based risks are, but I think that there will be some new there'll need to be some updates to that for sure in the future. The second thing, actually, which we don't really kind of talk about very much, because I saw corporate dentistry on there, but really, what are the as dentists and members, a lot of the comments that come out are, well, what is the intersection between corporate dentistry and potential government funding and public funding for a lot of new programs? Is there a lot of public programs right now like ODSP and Healthy Smiles and OW, and with the talk of creating new programs from the federal government, how does that relay or intersect with corporate dentistry and in terms of quality of care from both ends? So I think on one end we have corporate dentistry, and then on the other end there may be a component of what kind of public programs are being provided by the government in terms of quality of care for both. And really the experts would be, I think, the faculties of dentistries. They have a big role in that. But I think that's a very important emerging issue that we'll have to kind of keep tabs on as well. Otherwise, I really like how it's become very simplistic, because originally when I looked at the strategic plan, this is my first time doing this, first time elected. So when I looked at it, I was like, man, there's a lot of information here, and a lot of it seemed very redundant. But this is a very nice, succinct way. So I applaud you guys for doing that. Thank you.
Great. Thanks, Osama. It's great.
Thank you, Osama. Next on my list is Rod.
Andrea, good piece of work. Appreciate the approach to simplify the objectives, keep it simple, so to speak, and appreciate you mapping the original objectives to the new three pillars. My question is, would it be worthwhile to also map the original 6 values to our new pillars to make sure that we're still covering those? In particular, accountability. Increasing focus, in particular financial accountability to our stakeholders, would be worthwhile to make sure we put some emphasis on.
Okay, thanks, Rod. I'll take that away and give that some thought. I know there's, especially with accountability, there's, right off the top of my head, there's lots and lots of ways that the college demonstrates accountability. So yeah, let me give that some thought, talk with the team, and yeah, we'll take that away.
Thank you.
Thank you. Brian, you're next.
Thank you very much, Andrea and others for an excellent work as other council members have stated earlier. I think it demonstrates that a strategic plan should be a living, breathing document, ever changing to meet the changing needs of what we're doing here, and in particular how to best serve the public interest in an effective way. The boiling down to the three pillars and the way that they're outlined in the document certainly would be understandable, I think, to most people. It's a very proactive and public trust-driven document that I'm glad to see, and a related action plan that will go along with it is, and the enablers are great. So very, very well done, and I certainly would support going forward with this document. Thank you.
Thank you, Brian. Brian, I would ask you and Jack just to take a moment and lower your hand, please, so that unless you have another question. And next on my list is Jack.
Thank you. My hand is lowered. It's a great strategic plan. It's a great strategic plan. Thank you, Andrea. And I can understand it, which says something. Access to care, however, is probably the most important thing to our patients. And I know it's in our vision. Everyone in Ontario has access to safe, high quality oral health care, and I'm glad it's there. But when I look at the professional anchor, it does not emphasize the access. True, it is an area of focus, but it should be front and center in the preamble. Instead, it's used as an example. It's on a list of examples of professionalism. It gets lost there. And I think really it'd be nice in the preamble to say provision and access to quality care. In other words, to put the word access so that we're serious about access. We know we are, because it's there in our vision.
Okay, thank you for that, Jack. What I'm going to ask, if you're okay, Jack, I would propose I've got that noted down. We'll look at that for sure. If you're okay, I would propose that we go out with the plan, as long as council is of a mind to do so, and think about those revisions on once we get all of the feedback, so that we come back to you if that's agreeable.
Thank you.
Okay, wonderful. Thanks, Jack.
David Mock.
Sorry, it took me a moment to get my mute unmuted. I agree with a lot of what's been said, but in particular, Andrea, I would say it's an excellent plan. And one of the things I was pleased to see in there was the question of standards of practice. As you probably know, prior to COVID, the QA committee, under Mike's guidance, was looking at upgrading the guidelines and the standards, and in particular, changing some of the guidelines to standards. This has been halted because of COVID, Mike leaving, and I didn't want to load Susan up on their first day with this monster, but I would encourage you that this should be a significant objective to continue and move forward, that reviewing the standards and guidelines and making most of them, if not all of them, standards of practice.
Thank you very much, David. You're speaking my language. It's exactly on the list. And I hope to, the work with COVID is a significant workload, as is even doing the strat plan. But I do hope to be able to come back to council with some standards even this year. We are trying our best to move ahead, but yeah, rest assured that work won't be lost. We are going to move ahead with it. Thank you very much.
Thank you. Rod, I still see your hand up, but I'm not sure. Do you have another question? Okay.
No, thanks. I lowered it. Apologies.
Thank you for that. I see no other raised hands, no other names in the chat function. So at this point in time, I would ask that the motion please be put up onto the screen. And council, for your consideration, the second motion of today's meeting is that council approves circulation of the draft Rcdso strategic plan for 2023 to 2025 to external stakeholders. And could I have a mover for that motion, please?
I'll make the motion.
By Nancy,
Second.
seconded by Brian. All in favor? Opposed? Abstain? And that motion is carried. So thank you very much for that. And council, you will note on our agenda that we will be taking a break, but I'm going to propose that since we are working well, that we at the very least move on to item number 8 on the agenda, which is the conflict of interest declaration form. And that item is in your package at pages 117 to 134. You are being asked for your decision on 2 items. Conflict of interest declaration form. You are being asked for your decision on 2 items, an annual conflict of interest declaration form, which you will find at Appendix A, and a proposed bylaw amendment related to making council members' conflict of interest declaration forms public, and that you will see at Appendix B. And at this point in time, I am going to turn it over to Dan for him to provide an overview. Dan, to you, please.
Thanks, Hanno. I just see Mark's hand up. I don't know, Mark, if you had a question or oh, okay, accident. Thanks. Thank you, Hanno. Thanks, Council. I just want to do a really brief overview of what you have before you. I think the briefing materials and the declaration form itself were fairly self-explanatory. I do want to just again ground you in the fact that conflict of interest is one of the provisions or standards within the College Performance Measurement Framework, which is the provincial document that looks at standards across colleges and tries to bring some consistency in our approaches. And the CPMF says specifically that council members must complete an annual conflict of interest declaration form, that the completed forms will be included as part of the packages for council meeting materials, and that each council meeting, as you did earlier, you would declare any updates to your responses or any conflicts that you might have with specific agenda items. You'll recall that in March, there were a number of items related to conflict of interest in the bylaw that you made changes to. And that included a provision that required all council and committee members to complete this annual form. And we committed then as staff, and you're seeing today, that we would bring back the declaration form as we are proposing to use it in at least as a first go. And obviously, we're always willing to take feedback and evolve it as we move along. And also, there's a proposed bylaw amendment, which would make such forms public. We had an executive committee meeting in late May. It considered a number of issues related to conflict of interest, including these 2, and provided some feedback, which are incorporated into the documents, and it's here now for your consideration. If it's approved, it would be a June 30th bylaw amendment change and implementation date, and then council and committee members would have 60 days to return it to the college. And we would put a whole process in place that we would let you know what that would look like. And then in September, the materials or the declaration forms would appear in the council binders. So we will proceed with implementation after you've had a chance to consider this. On pages 120 to 121, there are instructions for the declaration form, and you can see the bylaw on pages 125 to 129. The real pertinent section that's being proposed as a change is on page 129, and that's at the bottom under 13.5.1, which is the amendment that would allow the forms to be public. So I will turn it back to you, Hanno. There are 2 motions and recommendations There are others who can be on standby to answer questions if I'm not able to. Alan Bromstein and Laura Thacker, who has been instrumental in preparing these documents. So back to you, Hannah.
Thank you, Dan. So at this point in time, I am looking to council for any questions that you have for this motion. Ellie?
Good morning. I just have a question about where it would be posted. Where it was supposed to, it supposedly it's going to be made public. That's the idea.
Yes.
So where will it be posted on the website?
So at this point, sorry, Ellie. At this point, Ellie, we're just looking at providing the signed conflict of declaration form that's been completed by all council members. It would be provided in the meeting materials. So it would be almost like a reminder to council and to the public. This is what individual members of council have declared as conflicts, and then it would be looked at just in the context at this point in terms of the meeting materials. So in September, you would see those forms in there for all 25 council members.
Thank you so much. I appreciate that. Thank you, Dan.
Thank you. Richard?
Thank you, Hannah. Number 2 on the conflict questionnaire is competing interests. And in particular, it's membership in any professional bodies or associations. So would that include elected members declaring their membership in, for instance, the Ontario Dental Association?
So I'm going to start, and then if Alan or Laura have anything to offer, please feel free. I would say yes, Richard. If you recall, in the eligibility criteria, to be eligible to run as a candidate in a district election or to be appointed, you can't be in a decision-making position for the last 3 years on any of those bodies that might have a conflict with the mandate of the college. And this is contemplating membership. So again, it doesn't mean that you can't participate in certain activities. It's just a way for the public to be aware of where you might have some competing interests. So for the ODA, yes, you would, as a dentist, if you're a member of the ODA, you would put that on this part of the form.
Thank you. Jamie?
Yes, thank you very much. My question relates to, are we falling in line with other colleges with regard to public posting of conflict of interest? Thank you.
I'm sorry, Jamie, can you just repeat that? I got distracted with something. I'm sorry about that.
No worries. Are we falling in line with the public public knowing about conflicts of interest with other colleges? Sorry, are we falling in line with other colleges with regard to public dissemination of conflict of interest?
Yes, absolutely. And this is now a part of what's expected of the 26 health regulatory colleges. I couldn't give you a number that have complied with this part of the standards at this point, but I would say a fair number have already complied with this part of the standards, and all of the others will be moving forward with this approach as well. So we're not out of step with any of the 26 health colleges.
Thank you. I see no further questions. So could we please have the first motion on the screen, please? And the first motion for council's consideration is that council approves the annual conflict of interest declaration form as set out in Appendix A. And could I have a mover for that motion, please? Moved by Vivian, seconded by Ram. All those in favor? Opposed? Abstentions? That motion is carried. Thank you. And could I have the second motion for this item on the screen, please? And for this motion, council, I'm just going to remind you, since this is a change or a potential change to bylaw, this will require a 2/3 majority. So after I have read the motion into the records, I would ask that you keep your hand raised. I will count, Angie will count, and keep your hand raised, please, until you hear otherwise, so that we can ensure that we have the correct majority for this. So the second council, or the second motion rather, for your consideration is that council approves an amendment to bylaw 13, article 13.5, to make council members' annual conflict of interest declaration forms publicly available as set out in Appendix B, commencing the September 2022 council meeting. And Joseph, I see your hand up. Is that because you want to you want to move this?
I just had a comment if it's in order about this motion.
So it is a comment or a question that you wish to make, or a comment you wish to make about this?
Yes.
Okay, well, the motion is being read on the record now, so go ahead with your comment or question, please.
Just wanting to get some clarification on the wording here about that the form or summary of the form will be included in materials. Who will make that decision? And why is that option being given? And when it says shall be publicly available, I understand that it's going to be included within council materials, but shall be publicly available kind of intimates that it's going to be like a continually available. So what measures are being taken to ensure that it will be not just part of the materials for one meeting, but will be that it will be consistently available for the public to consult if they need to.
Okay, thank you. Dan, can I turn that over to you?
Yeah, and I'm going to ask Alan if he wants to weigh in on this as well. But I think, Joseph, in practical terms, when we provide this information in council materials, those council materials are posted on the website and they stay on the website for a period of time. So it is publicly available. It's within that particular document or package. And as I said earlier, we're not anticipating using any other mechanisms to make it publicly available, but it would be there on the website. Now, if I have misstated anything, I just want to make sure that touch base with Alan to see if he has anything further to add.
Thank you, Alan.
No, the only thing I would add is you asked a question about who's going to make the decision whether it should be a summary or the form itself. I think what we're contemplating here is there could be some declarations of conflict relating to family members where it would be inappropriate for confidentiality reasons to put everything up publicly that you want the college to be aware of. So there could be situations where, and I'm going to let Dan answer who's going to make that decision, but I would think the decision would be made by the registrar in a coordination with the individual who disclosed the conflict to ensure that we are not breaching a third party's confidentiality or putting up something that could be potentially harmful to that family member. So that's what I think was contemplated. I don't know if we got so far as to think of who would make the decision as to whether it's a summary or the whole conflict of interest form, but I would think that would be something worked out between the person making the declaration and the registrar.
Thank you, Alan. And Joseph, I see your hand is still up. Is that just because you haven't taken it down, or do you have a supplementary question?
Well, perhaps I would just say as a supplementary that perhaps internally there should be some discussion about those questions, and in particular, how long it will be, like even if there's internal policy about how long materials are available on the website, just so that it's clear that it's not necessarily in perpetuity. That should be clear for the public in some way.
Well, the only difficulty I would say with that is when the materials go out to council and anyone attending these council meetings, those materials are accessible probably indefinitely because they're generally available. If it were to go somewhere else other than in the materials that go to council and are generally available, then yes, I can see why you may only want that up for a certain period of time. But I gathered from what Dan said, it's simply the materials from the council meeting that are going to contain the form.
Thank you.
Thank you. Dan, did you want to add anything further to that?
No, just to say to Joseph and council that we'll look at your question specifically, Joseph, as we start to map out the implementation component. And before we get any conflict of declaration forms back from anyone, we'll provide some more guidance in this area.
Thank you very much. There are no further hands up. So at this point in time, I would ask that the motion be put black on the screen again, please. Thank you. And council, again, for your consideration, the motion is in front of you. Just a reminder, it will require a 2/3 majority. So after I have a mover and a seconder, I would ask that your hands remain up until I ask you to put them down, and Angie and I will do a head count to ensure we require a minimum of 16 votes in favor of for this motion to carry. So if I could have a mover for this, please, Ram, and a seconder, Brian Smith. So all in favor of this motion, please raise your hand and leave it raised until I ask you to lower it, please. So Angie, I have 21.
Yes, I have 21 too.
Okay. The opposed? Abstentions? Thank you very much. That motion is carried. At this point in time, it is 10:28. We are going to take a short break now. We will resume at 10:45. Just a reminder to council to please just mute yourselves and turn your video camera off. And we will resume this part of the meeting at 10:45. Thank you all. Okay, thank you. Welcome back, everyone. We are moving on to item number 9 on our agenda, and that is rules of engagement for council. You will find the information regarding this item on pages 135 to 137 of your meeting package. Council is being asked whether it approves the draft rules of engagement. The rules of engagement have been developed based on council's feedback during its April 18th, 2022 educational session. The rules will serve as guidance for council meetings. They will also be included in the governance manual and orientation and will inform council evaluations. Before we turn to the motion, does council have any clarification questions regarding this item? Nancy.
Hi, good morning, Hannah. Thank you very much. I just wanted to know how we arrived at the attendance being at least a minimum of 75%. Why not more? Thank you.
And I know I can either pass this either to Dan or Sandy, so I'm not sure whoever would like to take this, please do so.
I'll jump in.
Thank you.
So Nancy, the way we arrived at that number in conversations as well with different council members, we have 4 council sessions a year. Their expectation would be sometimes you may have to miss one for health reasons or whatever, and that's how we came up with that 75. Like at a minimum, we would expect 75%. I hope, does that answer your question?
Yes, I guess my expectation would have been more than 75%.
Yes.
I understand. Thank you.
We would expect 100%, but things happen in life, so that's how we came up with that number. Thank you for the question.
Thank you.
Rod?
Just a supplementary on Nancy's question, perhaps Alan may want to intervene. Is there perhaps legal precedents or similarities to other boards, health-related boards, that also is consistent with that 75%?
Alan, I'll hear from you the legal perspective.
In your bylaws, in terms of potential for disqualification from council, I believe, and I have them up and I can look if you need to. If you miss without reasonable excuse 2 consecutive council meetings, you can actually be disqualified from council. And it is not unusual for colleges to have requirements that there be a certain level of attendance at council meetings, because it is your fiduciary duty to attend all council meetings that you can attend. And this is just giving some wiggle room for individuals who, for valid reasons, wouldn't be able to attend one meeting.
Thank you. Vivian.
Hi, just a follow-up question as well. Do we count those like short meetings, hour-long meetings? Do you add them up and then make it 75%?
Dan, I think staff takes attendance on the council meetings. And then in terms of the other committee meetings, again, pretty much the same thing. You look at if you have a patient registration meeting, you have so many per year. I think that's how we'll determine that. Dan, did you want to supplement?
Yeah, I think that's right. We're always, obviously the minutes are reflecting who was there and who's not there. I would just say that this is a benchmark that we've created. We have no concerns or problems with attendance. But if we do, we at least have something to fall back on. And I know that Sandy and I would talk about someone who has missed a couple of meetings in a row, and we would reach out, one or both of us would reach out to try to understand what the reasons were. But at this point, we're not dealing with any particular problems, but we are looking to try to make sure that there's at least an articulated expectation.
Thank you.
Thank you, Jamie.
Yeah, my question is this meant to be an evergreen document? Able to be amended, changed, added on to, etc.? Thank you.
That's a good question. I think for now, this is council's understanding of how do we communicate or conduct ourselves at these meetings. And for sure, going forward, if there's something we need to add, eliminate, revise, I think council would be happy to take a look at that, because this is council's document. So it belongs to us.
Thank you. Nalan?
Yes, good. Thank you, Mr. Chair. My question is not so much about rules of engagement, but better engagement. And one of the things that came out of our previous meetings was that small group discussions seem to encourage more participation and lead to more fruitful discussion. But I understand there's legal reasons why we can't do that. Can someone maybe just expand on what the legal reason is that we can't have small group discussions?
Alan, I will have you take that one, or Dan, if you want to jump in.
The simple issue is that council meetings, if you're having a formal council meeting, they are to be public. And I suppose you could have meetings of council or separate smaller group meetings of council, but you can't really consider that part of the council meeting because you're not all there at the same time hearing everything that's going on, and the public is going to have some difficulty attending multiple breakout sessions at the same time. So it's not that you can't have small group meetings, but whether it's part and parcel of the formal council meeting is a different issue.
Thank you.
And yeah, I would just elaborate and say, Nalan, that the design of that is intentionally to assure the public that they can see into the discussions, deliberations, and decisions of this body that's a public interest organization. So the more that we start to look at ways to hold discussions in camera or in small groups, the more suspicion there might be that decisions are being made without having those conversations in public. So to Alan's point, there are legislative obligations to go in camera, but there's also reasons why we can still have small groups and we can have educational sessions. We have to just find the right mix of doing that and making sure that any big policy, any policy decisions or directional decisions of the college are held in the public forum.
Thank you.
Thank you for that. Mark Trudell.
Thanks, Mano. Just a point of clarification, could you share with us, could a member of staff or Alan share with us where this proposed policy is tied to the bylaws? Should an individual be found not to be in compliance with the proposed policy regarding rules of engagement? In other words, where a member of council is found to be delinquent with regards to participation or attendance, just so there's either a solid line or a dotted line to our bylaws as to how to manage the situation consequentially. Thank you.
Well, I can start. This isn't a bylaw, and this isn't a disqualification from council bylaw or saying that action is going to be taken if these rules of engagement aren't followed. Although some of the rules are consistent with what the bylaw says and what the bylaw says about where you could be disqualified if you didn't follow the rules. But I didn't see this document as an enforcement tool. Now, Dan can correct me if I'm wrong, but rather a simplistic way of having council confirm some of the key fiduciary duties that council members have when they take their role as councillors for the Rcdso.
Thanks, Alan. If I could just add, Hanno, that I take Nalan's point that when you have a document that's headed rules, it means certain things. But if we remember the spirit in which this was developed, and something that this council's talked about for a long time, is how to better engage. And this is a document that was about how to make sure that there are some expectations that we have of each other in terms of our engagement at the table and outside of meetings. And this is not necessarily rules that are enforced, but they are things that we can go back to in terms of looking at reflections on a meeting. How did it go? Were there some aspects of this document that weren't necessarily carried out in a way that you would expect as council members? Is this something that we can put in front of people before they decide to run for council because maybe they can't live with some of these provisions? But there are ways to deal with bad behavior if that were to happen. And this is really just, I think, to your point, Nalan, it's more about better engagement and setting out some of these expectations. So we'll take that back in terms of how this is labeled. It is a carryover in terms of some of the language that we used at the April 18th session.
Great, thanks, folks. Maybe the misleading statement then is rules distinct from expectations, but thanks for those clarifications.
Hanno, if I may add to Dan's comments.
Please.
And again, adding to the engagement, when we are a council, the expectation is that we want to hear from you. And it's a way to, if somebody is applying to council or being elected, we do expect you to participate, to engage, but engage in a way that it's not personal. We're talking about issues and we have to respect everybody's viewpoint, but focus on the issue. So this is just a way to encourage individuals. Yes, please participate because we want you to. And it's a safe space. We're asking for your input.
Thank you, Sandy. David Bishop.
Yes, I just like to suggest that in the orientation of new members, that this point of attendance be included in the package, so that of the reasons why they need to be at these particular meetings.
Thank you. Joseph?
Yeah, so I apologize. I may not have heard the beginning of the discussion, but similar to perhaps what Mark had alluded to, What throws me off a bit is the term rules of engagement has somewhat of a militaristic context or allusion. So perhaps like member conduct guidelines, or rules for guidelines for participation for members. Something of that line would probably be, I think, more favorable. Thanks.
Okay, Joseph, I'm seeing a lot of nodding of heads, so I'm sure that your opinion will be noted. Thank you for that. At this point in time, I'm not seeing any other speakers. So I would ask to have the motion put on the screen, please. And this is motion number 4 in our meeting package today. And for council's consideration, that council approves the rules of engagement for council members attached at Appendix A. So I'm looking for a mover, please. Jack, seconded by David Bishop. All those in favor? Opposed? Abstentions? And that motion is carried. Thank you. Moving on to item number 10 on the agenda, council election selection update. Council is being provided with information on a new diversity self-identification questionnaire, a revised council skills matrix questionnaire, an update on candidate communication with the profession, and upcoming changes to governance election practices. The information for this item is found on pages 138 to 149 of your materials. I'm going to turn things over to Laura Thacker, who will provide council with highlights regarding these issues. Welcome, Laura.
Thank you, Hanno. I'm pleased to present to council today on behalf of the Executive Committee a council election and selection update. Today, I'll walk you through a new diversity self-identification questionnaire, a council skills matrix questionnaire, upcoming changes to governance election policies, and an update on candidate communication with voters. These changes, although modest, will help increase diversity and representation on council and committees, enhance the rigor of the competency-based assessment process, strengthen the decision-making capacity of council and committees, and ensure governance policies reflect current best practices and are aligned with changing public expectations. For each item, I will provide you with some background and analysis, speak about next steps, and then open the item for discussion. With respect to the diversity questionnaire, the college performance measurement framework requires that council and statutory committee members have the knowledge, skills, and commitment needed to effectively execute their fiduciary role and responsibilities. Diversity in perspectives serves to strengthen board decision-making capacity. The college is committed to ensuring that its council and committees reflect the diversity of the populations they serve, and is exploring ways to promote opportunities and encourage applications from traditionally underrepresented groups. This has been a priority for the organization over the past 2 years. The voluntary diversity self-identification questionnaire is included in your council packages on pages 143 to 147. It's designed to collect information on prospective council and committee members to improve diversity and representation of the overall complement of council and its committees. Mapping applicants' self-identified diversity attributes will enable the identification of gaps, which will inform recruitment, onboarding, education, and training. In developing the form, various websites were consulted, as well as agencies and regulators that use similar forms to gather data to comply with legislation and promote diversity and equity. We've engaged the services of our partner, the Canadian Centre for Diversity and Inclusion, to provide feedback on the questionnaire. That work is in progress, and the form that you see in your council package will be revised based on their feedback. Good practices, we know, are constantly evolving in this area, and so the form will require regular review and updates to ensure updated terminology and acronyms. Applicants will be invited to complete the questionnaire as part of their application process, and they'll be advised that their responses are voluntary and their information will be kept confidential and secure. The executive committee supported the adoption of the questionnaire. They provided feedback, which has been incorporated into the form that you see. At this point, I'd welcome discussion. Does council have any questions or feedback on this topic?
So any questions or feedback? Please, if you can, thank you, use your raise hand function. That's going to make it easier for me to monitor. Thank you, Jack. You were the first one to do it, and I'm going to turn it over to you now, please.
Just a question. This form will be given to all council and committee people, public members and dentists alike, I would assume. In that case, really, we should strike the electoral district line because it only applies to 12 members on the council.
Okay, thank you for that.
Thank you.
Thanks, Jack. Any other comments or questions?
Okay, I'll move into the second item, the Council Skills Matrix Questionnaire. The CPMF requires prospective council members to meet the articulated competencies. Council has established competencies that must be demonstrated as a precondition of eligibility for dentists seeking election or selection to serve on council. Currently, the Eligibility Review Committee is responsible for determining whether the prospective candidates meet the council competencies. This committee is comprised of regulatory experts who are all external to the college. At the March meeting, you'll recall the council was advised that based on ERC members' feedback during the last cycle, that they'd explore other methods beyond the current paper review of candidates to better support the ERC in its decision making. So based on that feedback, the council committee self-assessment form was developed, and the executive committee reviewed this form in May. Based on their feedback, a more fulsome version of the council skills matrix questionnaire was developed. And this was based on a form completed by council members in July 2021. This council skills matrix questionnaire is included in your council packages. It's on pages 148 and 149. It includes competencies that were not captured in the original survey, some situation-based questions that allow the applicant to demonstrate key competencies in greater detail, as well as some technical proficiency questions. This questionnaire, as well as the diversity self-identification questionnaire, will be incorporated into the 2022 election process. These forms, along with a written statement and a new CV requirement passed by council, will allow dentists wishing to serve on council to demonstrate the requisite competencies. Candidates will then be required to participate in a short interview with the Eligibility Review Committee panel. As set out in bylaws, this assessment process will only apply to dentists who have not previously been assessed and approved by the Eligibility Review Committee. And at this point, I'd welcome discussion on this particular topic.
Thank you, Lara. Any comments or questions? I'm not seeing anything, so I'm going to turn it back over to you, Lara. Thank you.
Thank you. With respect to the governance policies pertaining to elections, this is more of a preview of the next meeting of council in September. In preparation for the next election cycle, the college's governance policies for candidates seeking election or selection to council are being reviewed to determine whether amendments are required to enhance currency, relevance, efficacy, and clarity. Certain policies pertaining to elections will require revision as they include references to processes that no longer exist, contain outdated terminology, or require a stronger focus on the role of competencies. In September, council will consider modest amendments to these policies and the revocation of some deemed no longer relevant. Once the ERC assesses candidates, eligible candidates will receive campaign guidelines as well as relevant governance policies pertaining to the elections. Are there any questions with respect to this topic?
Any questions or comments for Lara on this item? I'm not seeing any, Lara, so I'm turning it back to you.
Okay, so with respect to the final item, information exchange between election candidates and voters. At the last council meeting, council was informed that the college was exploring options to support election candidates in their information exchange with voters. Considerations included eliminating mailing lists and labels and shifting to an electronic campaigning format. The college is unable to share email addresses of voters directly with election candidates, as this is considered protected information. We inquired with a vendor who administers the online voting platform about the feasibility of shifting candidate campaigning to a digital format. The vendor reported that it used to have a campaigning application in their online portal, but has moved away from this function due to perceived conflict of interest. So to avoid any potential conflict of interest in the election process, the college will continue to provide mailing lists and labels to nominees for the upcoming cycle. So to be mindful of our carbon footprint, we'll be asking candidates if they'd like to receive mailing labels. We'll only send the number of labels requested to minimize waste. Candidates, of course, can link to a personal campaign website to the online ballot in a similar manner that was available to candidates in the last cycle. The college can also use its own website, e-blasts, and social media accounts to remind voters of deadlines and candidate names. Does council have any feedback or questions on this topic?
I am seeing none. Thank you, Lara. So at this point in time, we're going to move on to item number 11 on the agenda, which is the Governance Working Group. And this is an item. The materials for this item are on pages 150 to 155 of your meeting package, and council, this is being moved forward or brought forward to you for your decision. By way of background, council will recall that the Governance Working Group was struck in November 2020. Since that time, the working group has engaged in important work and has achieved two important outcomes: governance guiding principles and the successful launch of the first council member performance evaluation, an improvement initiative. In consultation with the chair of the working group, the executive committee is recommending that the governance working group be disbanded. Council is being asked for its decision on that recommendation. The executive committee has asked staff to conduct an analysis on whether the Rcdso should establish a standing governance committee. Council will have an opportunity to review this analysis and discuss this matter at a future meeting. For now, council is simply being asked whether it supports the recommendation to disband the governance committee. And could we please see that motion up on the screen? So motion number 5, that council approves disbanding the governance working group. And I am looking for a mover, please, to that. Moved by Mark Trudell, seconded by Jamie. All those in favor? Opposed? Abstained? Thank you. That motion is carried. The next item on our agenda is item number 12, the National Competency Standards for General Dentists. Ben Lin is going to offer some opening comments, and then Jeff Goldberg will take council through a presentation. So Ben, I'm going to turn it over to you at this point in time, please.
Sorry, Hanno.
Oh,
it's Dan.
My apologies. Yeah. I jumped ahead on the agenda.
Okay, thank you.
So it's item number 12, National Competency Standards. But we are going to, again, this is an item for council's decision. Council is being asked to provide feedback on draft response to the Canadian Dental Regulatory Authorities Federation, the CDRAF. The materials for this are on pages 156 to 175 of your meeting package. And my apologies again for this group, but this time I'm going to turn it over correctly, I think, to Andrea.
Yes, thank you so much, Hanno. So Council, what's before you are a couple of things. You have in your package documents from the CDRF. And for anyone who doesn't know that group, just a brief, you have some information in your package about who they are, but just as a brief capture, this is a national organization where representatives from each of the dental regulatory authorities across the country sit. They have struck a working group and have developed a document setting out national competencies for a beginning dentist. They are now inviting comments on that document. I'll provide a couple of highlights, and the goal here really is to get your thoughts and comments on a proposed draft response. We have been included, the Rcdso, in a consultation the CDRF is running. Feedback is due July 15th, so we're working ahead of schedule, but really wanted to take the opportunity to come to Council with a draft response so that you had an opportunity to weigh in, should you wish it. Maybe by way of background, I'll sort of provide a couple of quick highlights. This is work that the CDRF has been engaged in for some time. It started back in, I believe, even 2019, even perhaps late 2018. Our Patient Relations Committee, some of the members will remember this, did some early work to support these efforts, really identifying from a public perspective, what are the competencies that we would want the beginning dentist to have that are not clinical, but are more in the realm of professionalism, that patient interaction. That feedback has been taken to heart, and the recommendations from our Patient Relations Committee and public representatives from the Quebec College have been included in this draft. This did go forward to the Quality Assurance Committee in May, and the committee offered some comments, its thoughts about the draft. I used those comments to put together the draft response that's before you today. You can see the draft response is largely supportive. It's congratulating the CDRF on this work. It's offering a couple of constructive comments. I know members of the Quality Assurance Committee are here today, so they can certainly weigh in if there's anything they wish to expand on. But I'll stop there, and really the question for you is, are you content with the draft Rcdso response? Is there anything you wish to add or amend? Thank you, Hanno.
Thank you, Andrea. And please, again, if you have a question or comment, if you could use the raise hand function, that would be ideal. But I'm scanning the screen and I'm seeing no indication. Oh, David Mock, please.
Sorry, I just wanted to confirm what Andrea said. There was extensive discussion at the QA meeting, and although there are always little items individuals may or may not agree with, keeping in mind that old saying that a camel is a horse designed by a committee, we approve of this document.
Thank you. Any other questions or comments? Oh, Peter?
Yeah, the comment I have is, will the public have a chance to comment on this or to see it and maybe to read it as well?
Peter, this is a consultation that the CDRF is running. I don't have, so it's not something that the Rcdso, we are a participant. We're not launching this consultation. I don't recall offhand who the CDRF invited to participate. So I'm afraid I just don't have that answer for you. Again, it's not a process the Rcdso is managing. So.
Yeah, I was just curious if there was any public input along the way.
I can tell you that certainly at the very earliest stages, when Erwin Pfeffergrad was still in the registrar role, both he and I advocated very strongly that the public needed to be involved at the very earliest stages of this work, so that we were able to capture, CDRIF was able to capture not only clinical elements, but as I mentioned a minute ago, those other elements. What does the public expect from their dentist? What's that interaction like? And it was for that reason that our Patient Relations Committee and public representatives from the Quebec College did that earlier work, had a half-day workshop, really put together some specific recommendations. So I can tell you that certainly from those early stages, the public was involved by way of our two colleges, but yeah, I'm not sure what else the CDRIF is planning.
Thank you. And at this point in time, I'm not seeing. Oh, so Dan?
Thanks, Hanno. I just wanted to briefly weigh in on the last comment by Andrea and the question by Peter. It may be useful for us to provide that as feedback in our response, that there should be some kind of public consultation. Of course, as Andrea explained, it's not our call. I can certainly advocate, as I have as well on the board of CDRIF, that there be more public input, but I think it's worth repetition, and we'll support CDRIF in whatever way they can get that kind of feedback as well. Also looking forward, this sort of exercise will likely take place with respect to specialty training programs. Lots of discussion that's happening, as you know, about the examinations and the training programs. So again, we'll have an opportunity to weigh in at an early stage, hopefully, around appropriate consultation for any work that's done that's consistent with this in specialty areas.
Thank you. Osama?
Yeah, I just have a quick comment. So thank you for sharing that, the draft response. I think, yeah, those, the 3 points in the draft response around boundaries and, sorry, I'm just scrolling through it here real quick, taught and tested and informed consent. One thing that I've always thought would be pretty good idea in the curriculum is shadowing. And in the taught and tested, it's, maybe adding another column in there, right? Because there's taught and tested, which might not necessarily give you that experience, watching, let's say, an endodontist do a root canal, or shadowing in an oral surgery clinic, or shadowing in an oral medicine clinic. I find that in the US, they do that a little bit more, where there's more of that exposure, but it's different than an actual exposure to doing a procedure. So I guess, there's taught and tested, and then there's exposure, and then there's competent. There may be room for another column in there for possible shadowing. Again, just a thought. I'm not sure what the committees and what David thinks of that. I'm curious to see what Dr. Mock thinks.
Thank you. So, David?
Just to answer Osama's question, I would have assumed that would be under exposure or observed, but I may be wrong. We certainly within the faculties, when I was dean within our faculty, there was that element of exposure in specialty clinics and in hospitals. But so I think it's covered there, but I'd have to ask Andrea if she means it to be covered.
You know what? I did not contemplate it in that amount of detail. So really, I think that if we're content, what I would probably say is, if we're content that we think shadowing is a good idea and something we want to flag specifically, I think there's no harm in actually putting it in a letter and saying, not sure. We can frame it in such a way as to say, we're not certain whether this has been covered, but if not, you may wish to consider this element. And then it kind of covers, I think, your point, Osama, but also David, yours, that, they may have already thought about it. So I probably would suggest that, if that's agreeable.
Thank you. Harinder?
Thank you, Hanno. Just going from David Mock's comment, at Western, it definitely happens. Students are going through specialty clinics. I can tell you that as a periodontist, it was a requirement for fourth-year students or other students to come through my clinic, for example, or other periodontist clinic, and oral surgery, endodontist, and community participation as well. So it is already there. Putting it to be more complete wouldn't be a bad idea. Thank you.
Thank you. Dan?
Sorry, it took me a while to find the mute button. I just wanted to add to the previous discussion. Angie's informed me that the document is on the CDREF website. So it's available to those who find it and wish to respond. It doesn't necessarily mean it's an active consultation with the public. We don't have that answer, but I have been told that it's on their website.
Thank you very much. So at this point in time, I'm seeing no further hands. If I could have the motion on the screen, please, for council's consideration.
Hanno, may I just interrupt you for 1 second, if that's okay? While the motion is up, I just want to clarify then, what I heard was two amendments. I heard including a line per Peter Delean's comments about suggesting the CDREF circulate this to public stakeholders, and hearing what Dan said, it's on the website, but I think there's room, if you're of a mind to do it, to suggest that they actually send it to public stakeholders. And then I think the edit that Osama proposed with David's modification, that we're going to suggest that they consider, if it's not covered, that they consider shadowing. I just want to make sure that I'm clear. Those are the edits that I have heard. So if people are unhappy with that, please say so. But otherwise, I will take that away and I will finalize the draft with those edits included. So thank you, Hanno.
But Andrea, just to clarify, since this is approval of a draft, those comments, that input, you can still take away. We do not need to change the wording in the motion. Is that correct?
No, the motion can stand as is. I just wanted, before council voted on the motion, I just wanted to be clear. Those were the two edits I heard. The motion can stand exactly as is, but I will include those two points in the final version based on council's feedback.
Okay, thank you very much for that clarification. So council, the motion in front of you for your consideration is that council approves the draft response attached as Appendix C with any revisions council requests to be forwarded to the Canadian Dental Regulatory Authorities Federation, CDRAF. And I am looking for a mover for that motion, please. Moved by Christina, seconded by Richard Hunter. All those in favor? Opposed? Motion carried. Thank you very much. We are going to move into one other item before lunch, and that is a recommendation from the Finance, Property, and Administration Committee regarding membership fees. This is an item for council's decision. The materials can be found in your package at pages 176 to 191. Ben Lynn is going to offer some opening comments, and then Jeff Goldberg will take council through a presentation. So Ben, I'm going to turn it over to you now, please.
Thank you, Hanno. I am pleased to bring you the report on fees under agenda item number 13. I'd like to thank my colleagues on the FPA committee, Jamie Colliver, Sandy Van Diddie, and Peter Delean, as well as members of the audit committee who participated in the discussion, Rod Stapleforth, Amelia Chan, and Mark Eckler, for their commitment and support. I would also like to thank Jeff, Kelly, Sharon, and the rest of the finance team for all their hard work in preparing the materials before you. Council has been presented with information on the professional liability program several times over the past 12 months. It is clear that the program is not adequately funded and directly impacts the financial results of the college. This has contributed to ongoing deficits and an inability to make progress on funding the operating reserve and is not sustainable in the long term. At the FPA committee meeting in April, staff presented financial information and analysis, including several different models to fully fund the PLP program, a multi-year forecast with detailed assumptions, benchmarking information to review the cost of offering a malpractice liability program, and consideration of the dramatic increase in inflation. This is important given that fees were held flat for 2022, while costs and services the college pays for are rapidly increasing. Based on all the information provided, the FPA committee, with input from the audit committee, agreed upon a recommendation for council's consideration. I'll now ask Jeff to run through the presentation that the committee received, and then we'll be pleased to take any questions. Thank you. Over to you, Jeff.
Okay, thanks, Ben. So the material does start on page, 1 second, please. 176 in the council package. There are 3 attachments that support the BN. So there's a multi-year forecast in Appendix A, and Appendix B and C have the red line include version of Bylaw 18. Next slide, please. So there's 3 objectives or outcomes associated with the fee increase. A, we need to continue to be fiscally sustainable in the long term, which includes adequately funding PLP and our regulatory programs, and covering increases as costs continue to rise with high inflation. B, it's important that we are transparent to our registrants so they understand what the fee covers. And C, we need to deal with risks that have been identified. First, we've seen over the past few years that PLP is volatile, and our focus really has to be to ensure we can fund the program. Second, the operating reserve balance is 1.5 million currently. Based on the 2021 actual results, it should be at 6.6 million. So we have a $5 million shortfall there. And running a deficit will not allow us to increase the fund. Last, no funding has been accounted for likely future costs, such as government modernization, in any of the financial models we have developed. Next slide, please. So the college has been experiencing deficits for 5 years. And we have a deficit budget for 2022 this year as well. So over those 5 years, that's accounted for 7.6 million in deficits. The budget for this year is set at 731,000 deficit. But if PLP was at the same level as in 2021, we would be looking at a deficit approaching 3.8 million. So obviously continuing on this route is not sustainable in the long run. Next slide, please. So as an example of a fee increase, we plugged $350 as just to see where that would end out in our multi-year forecast. And it would result in 2 more years of deficits. So you can see from 2017 to 2024, those forecasts, we would almost have experienced $10 million in deficits. And this would lead to deficits over the foreseeable future and make it at least 8 years in a row. So I think that clearly illustrates that an increase is warranted. Next slide, please. So council's seen this slide before. So this really demonstrates the financial impact of PLP on the college. So in the bar charts going across, the bottom bar is the loss provision. That's calculated by the actuaries and includes activity on current and expected future claims for the PLP program. The amount on the top in light blue is the cost of running the PLP department. So salaries, insurance, committee costs, things like that. Now, when you put them together, they are significant. In 2021, they total more than $11 million. Now, the line that is going across represents the PLP expenses as a percentage of the entire college budget. So in 2021, that amount was 31%, or roughly a third of the college resources were invested in PLP in 2021. Now, you can see PLP costs have increased if we had more columns, you would see the amount before 2017 very close to that. So costs have increased over a number of years, and members are really only funding a portion of the college's cost, which is placing the regulatory side at risk. Next slide, please. Now, we did increase the budget in 2022, this year, for the loss provision for PLP to 5.5 million. So that is definitely a step in the right direction. But we think that may have, the risk is increased based on the 2021 results and recent trending. So the loss provision, we hope it's sufficient, but it may not be. Next slide, please. So this chart on the right provides this is about the loss provision again. This provides the actual results, the budget we had set, and the difference of how much was underfunded every year. And over 4 years, it was underfunded 15.5 million. So we need to fix this funding problem and budget appropriately in the future. Now, two numbers that sort of stand out this year, if you look under the actual, loss provision actual, 2020 was 5,955, 2021 was 8.6 million. So that's an increase of 44% from year to year. I mean, it could also go down by that same amount. The point is the number is extremely volatile. And the trend over the past couple of years has been, we've experienced more serious claims and a higher average payout. And we have experienced a few class action suits in 2017-18. Next slide, please. So this is how we allocate the fees between PLP and the regulatory side currently. So the way we developed this, we took a year that was close to break even and applied those percentages to the fees. So in 2020, which was close to break even, 27% of the college resources supported PLP and 73% supported regulatory programs and infrastructure. So that equates to the annual fee funding $680 for PLP and $1,830 for the regulatory programs. So that's really our base level. Next slide, please. So as Ben mentioned, several funding models were developed using all sorts of different factors and assumptions. We looked at actual results of the program. We looked at averages. We analyzed the amount of the increase to fund ongoing deficits. We looked at changes when parameters were revised and developed a forecast, which is in Appendix A, and we'll talk about more shortly. Next slide, please. So in addition to funding PLP costs, we have to account for rising costs over the past 2 years in both regulatory programs and infrastructure, and we'll talk a little bit about that in a few slides. And we also, as part of this analysis, looked at comparators for malpractice insurance. And based on our analysis, we prepared a range of fee options for FPA's consideration. Next slide, please. So the multi-year forecast deals with the entire college financial picture and is probably the best source to determine what the increase should be. I think it's important that we cannot rely on investment income to bail us out of our deficits. Although in 2021, it was well over budget. If we had hit right on our budget, our deficit would have been worse by 1.1 million or 3 million in total. This year, it's a little bit different, and our equity investments are struggling, as probably most people's portfolios may be. And we've built a number of assumptions into the forecast, and they're included on the face of the document. Next slide, please. So we did undertake some malpractice benchmarking. There are 2 other colleges that have a liability program. So Alberta recently launched their program, which uses the insurer to handle all claims. They have not looked at a staff model yet, but they probably will in the future. And the Quebec model offers mandatory coverage through a professional liability insurance fund. We also looked at CDSPI, which is the agency used by the other 7 provinces that don't have a malpractice component to their fee. And we spoke with JDMI, our insurance broker, for a cost estimate. Next slide, please. So here's how the numbers shake out. So to acquire malpractice insurance externally would be much higher than through the college. And we are currently less than half of the next least expensive option. So even a $500 increase will keep us well under Quebec's total fee, which is the closest direct comparator. Now, Alberta's fee includes both the college and the association, so it's difficult to compare on the regulatory side, although they have recently separated. But the malpractice insurance number is a direct comparator to PLP, and they've set that at $1,450. And they used a number of our policies and consulted with our team when developing their program. You can see the CDSPI number and JDMI. They know that each dentist would be individually assessed on several factors if they had the program, including claim history in areas of practice. Next slide, please. So this is not news to anyone, but inflation has risen dramatically. It's unclear when a return to normal, but earlier claims that inflation was transitory seems to have been incorrect. So inflation impacts consumers and businesses alike, and everyone has felt the impact, including the college, which is a reason that freezing fees is not necessarily the best strategy. We eventually end up playing catch up if there are no small annual increases. Now, we've experienced increases across the board due to energy increases, supply chain disruptions, and professional service increases, to name a few. This is a specific example. Recently, we received our quote for cyber insurance, and it was up 49%. So it's not a big overall dollar amount, and that's not due solely to inflation, but this gives a sense of rising costs the college is facing. Next slide, please. So we have 2 years of catch up for inflation. We used the June CPI numbers from Stats Canada when we built our annual budget. The rate in 2021 was 3.2%, which would have equated to an $80 increase in the membership fee. So if we had not frozen the fees in 2022, we would have had a small surplus budget instead of a deficit, but holding fees flat was a response to the pandemic. And over the past 12 months, ending April 30th, inflation has surged to almost 7%. So it's important in the future that we account for the impact of inflation when considering a fee increase. Next slide, please. So some of the considerations we need to think about when determining what is an appropriate fee increase. One is the operating reserve. So as I mentioned, that's underfunded by $5.1 million. Now it's a requirement by CPMF. We've reported 2 years in a row that we'll fund the reserve over the next 3 to 5 years. Now, if we don't, we know the government intends to publish benchmarking, and the government may question why we're not compliant, particularly when other colleges are reporting compliance. So we checked the CPMF of 10 colleges, including the largest ones, and 100% of those reported compliance in this area. So we will be an outlier in this category. Additionally, funding the reserve was specifically recommended by the external auditor in their year-end letter. Second, we have not built funding into the multi-year forecast for initiatives that will arise from the new strat plan or externally driven disruptors such as government-imposed modernization, French language translation, and I'm sure there's others. And due to the volatility of some of our numbers, even with the fee increase, there's no guarantee of a surplus, but obviously a much better chance. Next slide, please. So in the models we developed, they yielded similar results. They're really from $450 to $600. But we do believe the multi-year forecast includes the most data and is the best model to rely upon. And the BN provides the impact of 3 different fee increases. And after much deliberation and discussion, and considering all the information provided, FPA has a recommendation for council. Next slide, please. So the FPA committee recommends an increase of $485 for the 2023 membership fee. And that is a split between an increase to the regulatory side to account for inflation and other resources to carry out our mandate, and more appropriate funding for PLP, so costs are covered. So it was important to FPA that the fee be kept under $3,000 in total, and that was achieved with a $485 increase. FPA also recommended that an annual CPI factor be suspended for another year, as it's already built into this increase, and then we'll reenact that for 2024 and going forward. And that's in Bylaw 18.3.13.1. Next slide. So we ran the 485 number through the analysis, and it does result in projected surpluses for the next 2 years, and those are on the slide. So if those forecasts are close to actual, we will be able to apply some funding to the operating reserve, which will be terrific. We will still rely on good investment returns, though, and cost reductions to achieve meaningful additions to the operating reserve. Next slide. It's important that registrants know what they're paying for with their funds. We'll develop a comprehensive plan with communications to make this clear in both the circulation that will go out shortly and in when the renewal time comes in October. Next slide. So we're asking council for approval in principle so that we can circulate to the members and stakeholders for 60 days. And we will ensure FPA has access to the feedback and our responses. Now, the timing is important so we can finalize the fee in September at the council meeting, as membership renewal starts early October. So we will keep the forecast updated and regularly report to FPA so we don't fall behind again. Next slide. So there will be 2 motions read. One is to change the annual membership number from 2510 to 2995. And those are reflected in Appendix B and C. Next slide. And the other recommendation for the bylaws is suspending the CPI increase for 2023, as we already have an inflationary factor in the fee adjustments, but put that back in play for 2024. Small annual increases are important so we don't have to play catch up in the future. So those are the comments, and Ben and I will be happy to take any questions, and I'll turn it back to you, Mano.
Thank you both to Jeff and Ben for that presentation. And at this point in time, I am looking to see, okay, Osama, I see you've raised your hand for a question. So Osama, please.
Yeah, so obviously this is going to be covered by the members. So what I guess, you know, that's about like a 15 to 17% increase in the fees. I'm just wondering about the optics of that too. And you know, we're still in a pandemic. And then combined with the fallow times and the positioning that the colleges, have from a fallow time standpoint and limited number of patients that we have coming in, the burden is, an increase of 17%. While I understand the numbers, it was a great presentation, Jeffrey, and the numbers obviously make sense and they're there. I am concerned about the optics of that. And secondly, I like the chart about the liability, the liability and the regulatory, the costs in comparison between Quebec and CDSPI and JDMI. But what about including like a more comprehensive chart that includes all the different types of fees that the dentists or the members have to take on, like for HPC and for CT scans, and how that compares to other colleges as well across the country, to give a more comprehensive picture in terms of total costs, because when we say total costs, it really doesn't reflect the total cost, right? There's other fees as well for sedation permits. There's fees for CT scans, and there's HPC. So I think, and I could speak for myself on this, when I look at my email, there's, every couple of months, there's another cost, there's another expense. And so while I understand, and many members do understand the value and the numbers, they do make sense, Jeffrey. I'm more concerned about the optics and how we can really present this information clearly in comparison with other colleges, giving a full picture with all the expenses, and not only from a liability standpoint. Thank you.
Thank you. Richard Hunter.
Thank you, Hanno. Question for Jeff. The PLP's loss provision, would it be expected to go down considering the settlement of the class action lawsuits?
Jeff, can you?
Well, yeah, we did settle one in 2021, and our loss provision went up like 44%. So there's many other like large cases and payouts. And what happens when the actuaries look at it, if there are larger payouts than expected for prior years, that really impacts how they calculate the loss provision. So, the next one, which we're paying this month, is much less than the reserve. So that should have a positive impact. But when we met with PwC last year, the trend was that things are not going to get better in the short term.
Okay. Next, I just want to ask, do you consider other options? I'm not against raising the fees to cover our expenses, obviously, but I'm just wondering, did you consider increasing the deductible? Did you consider user fees, frequent flyers? I'm a big fan of user fees. So if there's frequent flyers, they should be paying more of the share of the costs for PLP.
Yeah, we are starting to look at that. The committee has asked for a lot of that information. So we do have a little subgroup working on the deductibles and understanding all aspects of that. I don't think that would result in a big enough increase if we go from 2,000 to 3,000. It's not going to have probably the impact we would hope. And the other one, we'll look into that more deeply. But if we start assessing each dentist and their specialty and their number of claims, we're going to need some expertise on staff in terms of, because then we start to run it like an insurance company. It gets very complex.
Sorry for cutting you off, Jeff. So Dan, I know you want to respond.
Yeah, thank you, Hanno, for letting me jump in the line. I just wanted to respond and elaborate a little bit or emphasize that obviously since last May 2021, when we first provided a lot of information to council about PLP and some of the issues and risks that we were seeing, this issue is a very active issue with the audit committee. The audit committee is well placed because it deals with risk, and it is looking at all aspects of PLP, and obviously working with the finance committee. As you heard earlier, there's been a couple of meetings where those two committees have come together. So we're getting very strong advice from two committees that are meeting in tandem and including this issue. I just want to emphasize that we're dealing with a multi-million-dollar problem, and we can't solve it with tens of thousands of dollars of solutions. And so we've looked at, and we'll continue to look at those ideas that relate to things like deductibles or multiple claims. But I don't think we could ever imagine increasing those amounts to an amount that would allow us to deal with this multi-million-dollar problem. And to Jeff's point, we have a huge job in educating all of you and the audit committee and myself and others, because this is a complicated business. And so, Richard, your question off the top is absolutely expected. Will we continue to see these without the class action lawsuits? Will we continue to see loss provisions at this level? And I think the answer is there's so many factors involved. Actuaries have to be involved. That's what we have to do. And we're seeing that these factors are not lining up that way. So I think we just have to be realistic in terms of how to solve this very significant global budget challenge for the college, and continue to look at lots of other ways that we want to move the program forward.
My one concern is that when you're keeping up with inflation, CPI, you're causing inflation.
Ben, I saw your hand go up. Did you want to respond to that as well?
Yes, Hanno, thank you. Richard, I just wanted to reassure you that at that last combined FPA audit committee, everything you just mentioned about stuff like deductibles and other options was brought up at that committee, and that we have requested for additional information. So I just wanted to know that it was discussed already. So
thanks, Jeff, Ben, and Dan. Thank you.
Next on my list is Rod.
Yeah, most of my questions have been answered by Richard and Ben, but that work, I'm part of that work with FPA and audit, and substantial questions were put forward to educate us and provide us with information with which to make a more enlightened recommendation. That work is pending shortly, and just like to let the council know we are on it to the best of our ability. Another point, Jeff, is that the current 2023 plan, which the fee based and your surplus is based on, assumes, I think it is roughly a $5.5 million PLP expense plan. Is that correct?
That's our budget this year. So the forecast in Appendix A for 2023 has, I think, an $8 million.
Yeah, that's well. So I was asking to what your confidence level on that was, and your forecasts on surplus are based on plan, or they're not based on forecast. Correct?
Sorry, I'm not following.
Well, I'm just saying there's still substantial risk in 2023 based on and what's coming, I guess, in terms of the PLP loss over and above what we have planned for.
Yeah, I think, our two big volatility lines are investments and the PLP loss provision.
So,
sure.
So given everybody's comments on optics, I empathize, but this could be worse than we predicted. In fact, actions are even more mandated, and we have to do a good job of explaining that to the membership, but it's almost necessary to do.
Yeah, and I think even if, the loss provision does work in our favor next year, then we'll be able to fund our operating reserve,
okay.
Which is big need as well.
Thanks.
Next on my speakers list is Jack.
Thank you for the presentation, but some of my questions were answered, especially with the PLP, and I'm glad that you're going to be looking into it. Suggestion is even a fee to start a file would be good, but you're right, Dan. Tens of thousands of dollars is not going to make up for $1 million losses. I understand the need for a fee increase. We're looking at 20% for 1 year. But, you know, I look at my office, I look at the dentists, the young dentists especially, and I don't have to tell you, I could spend the next half hour telling you the plight of the dentists and the dental offices over the last 2 years with regards to COVID, all the expenses to maintain the office, to repair the office, to bring the office up to specs, the PPEs and so on, not to mention the patients who are not coming back or are not coming back as frequently. And then on top of that, you talk about fallow time. We haven't got back to, you know, to pre-COVID times yet. And, you know, there's a lot of suffering out there. Having said that, we've got inflation, which is running high. And we have staff costs. If you could find a staff, we're going through a lot of staff right now, trying to find good staff. And if you can, it's so inflationary, you've got to pay big dollars. There's a lot of pressure in the dental office. And Ben, I'm sure you've talked about this, and I know you had. The optics, you're right, Osama, looks terrible. And we're going to have to explain it. But there are going to be dentists, there are going to be members who are going to have financial hardships with this fee. It's $3,000 plus all the other expenses in life. Not to mention their mortgages and everything else. You know, there's some real hardships out there. And I think at least, and I don't know if we're prepared to do this, have some kind of payment plan, or at least have kind of access so the dentist who is having some hardship can talk to somebody in private and arrange some type of payment plan that's suitable to the college, whether we do a monthly or whether we do a biannual, you know, on 2 payments, something to lessen the burden, because it's a lot of money up front.
Thank you. Nalan?
Yes, thank you, Mr. Chair. I just want to make a comment on the concept of the firewall that exists at the Rcdso, whereas the people and the staff and the committees that deal with PLP do not share information with people on the regulatory side. There's a firewall at the Rcdso. But we bundle our fee. When we go to our member dentists, they're given a fee. And so does that diminish the concept that there is a firewall, because the fee is to pay for everything? So I'm just wondering, is there an opportunity here, because we have to tell the members while we're raising the fee, and most of it is because of PLP, is there an opportunity here to split it so that we can tell people, yes, there's a firewall, and you see there's 2 different fees, and B, your fees are going up, not because, you know, the administration is getting bloated at the Rcdso, it's because of the PLP. That's my comment.
And maybe I can respond to that. Definitely, which is why we're trying to split now. So we talk about how much PLP costs, how much the regulatory and infrastructure costs. So I don't think we can do that on the renewal, but we can look at that in terms of the communication plan, maybe even the receipt the members receive, so they know exactly what they're paying for. How much is PLP and how much is the other piece. But I think there's legal ramifications, and you can correct me if I'm wrong, about separating them in the portal so they could pay each separately.
Thank you. I have 2 speakers still on my list. The next one on my speakers list is David Bishop.
Thank you, Jeffrey. My question and the other discussions have answered some of the questions, but is it there's more dentists being sued, or is it just the value of the suits themselves? Like, are we kind of constant on the number of that are coming each year, but the value is going up of how much has to be paid out?
Yeah, I think, and Al Chappelle may be on the call who can help me with this, but we are finding, I don't think it's more cases. I think it's more severe cases, and we're having larger payouts. Yeah, the question that was raised before about if some the dentists, the professionals, are more often being sued, why can't, I mean, you are becoming an insurance company paying out, but surely some of these people, if they're being sued, would they not be coming before one of the committees to look at how they're practicing the dentistry? I'm just looking at it from an outsider, not being within the profession. Yeah, and I think, that's one of the reasons we're definitely looking in detail at the deductible process. And in certain cases, those are waived. So we need to understand why that is the case. And then on the flip side, the audit committee is looking much broader at the program. And if there's ways, like you say, like frequent flyers, should it be paying more? Is there an opportunity for that?
Thank you for that, Jeff. And last speaker on my list is Nancy.
Sorry, my apologies. Thank you, Jeffrey. That was very, very well said. Thank you. I agree with many of the comments. And in light of what Jack mentioned, I was thinking the same thing. I don't know if there can be provision for options of financial payments for some practitioners who would like that. I know we already have, if paid before December 1st, there's one fee, and if after the December the 15th, there's another fee, but maybe a payment plan option might be a suggestion to consider. Thank you.
We can definitely look into that.
Thank you all for your questions and for your comments. At this point in time, I would ask if we could have the first of the two motions placed on the screen, please. As it's being loaded, I'm going to remind you that this approval of this requires a 2/3 majority. So once again, after I've read it and asked for all those in favor, if you would please keep your hand up so that Anjan and I can do a count. So the first motion for your consideration is motion 7A, that council approves in principle changes to bylaw 18 fees as presented in Appendix C, effective October 1st, 2022, and that the proposed bylaw amendment be circulated to members and stakeholders for at least 60 days. And Alan, did you want to speak to something first?
Yes, this does not require a 2/3 vote because it is an in principle amendment. It requires only an ordinary motion.
Okay, thank you for that clarification. Okay, so thank you. I should be able to count this one on my own, Angie, then. So all those in favor of that motion, please indicate now. Opposed? Abstentions? That one abstention, okay, that I can see, that motion is carried. Thank you. If we could have the second motion. Motion 7B.
Come on in, Kishan.
Oh, sorry, okay, 2 abstentions, thank you, from the last vote. So Alan, I'm going to ask you again, if this is an in principle, does this require a 2/3 majority or not?
No, it does not.
Okay, so if you would please then just disregard the 2/3 majority. The second motion for this issue for council's consideration is that council approves in principle the amendment of Article 18.3.13.1 to replace October 1st, 2022 with October 1st, 2023, and that the proposed bylaw amendment be circulated to members and stakeholders for at least 60 days. And could I have a mover for that, please? Moved by Brian, seconded by Mark Trudell. All those in favor? Opposed? Abstentions? I see 1 abstention, thank you. That motion is carried. And Dan, I'm going to ask you a question right now because as I just did that motion, I do not recall asking for a mover or a seconder for 7A. So I just want to make sure that I did do that. Do we have a mover and a seconder for motion 7A?
Yeah, I will move.
Sorry, Hannah, I guess I would turn to Angie to see if that was done.
Sorry, Angie, I'm sorry for this. I cannot remember asking for a mover or a seconder for.
No, I didn't record a mover or a seconder.
You did not?
No.
Okay, so then Alan, can I just ask for it now, or do we have to go back and put the motion back on board to make it legitimate?
No, I think you can ask for a mover and a seconder for the motion 7A.
Okay, so at this point in time, my apologies for that mix-up. I would look to see, to have a mover. I saw Ram, did you put your hand up to move
Yes.
motion 7A, and could I have a seconder? Joseph Richards. So my apologies for missing that, but thank you. Dan, I know we said we were going to do the next item just after lunch, but can I throw it to you now?
You want to do it now?
The introduction?
Sure, we can do that. I hope our staff are there, but we'll find out in a minute. One of the council members suggested that when we introduced our new members of the leadership team this morning, it'd be nice to just have a face to a name and a very quick hello and introduction. So we thought we'd take a couple of minutes and we'll just go in order in which they were presented. Maybe if Danielle Rodet, who's the new manager of our facilities inspection program, can just say hello to the group.
Hi, thank you, Dan. Good afternoon, council members. Thank you for this opportunity. As Dan stated, my name is Danielle Rodet, and I joined the college in January of this year as the manager of the facilities inspections program. I'm a lawyer by training, and I most recently worked at the College of Immigration and Citizenship Consultants. And I must say that college staff and members have both been so welcoming since I joined. I'm very excited to be a part of the wonderful initiatives that we're taking at the college this year.
Thanks, Danielle. And now we'll turn to Susan Taylor, who is our new Director of Quality.
Thanks, Dan, and thank you to Council for giving me the opportunity to introduce myself. I'm very pleased to be here with the Rcdso. Today's my 1-month anniversary, so my learning curve is still very steep. I bring a real passion to the team for quality improvement, and change leadership, and really looking forward to continuing to work with the Quality Assurance Committee and our staff to deliver on our statutory obligations, advance our strategic priorities, and support dentists to meet their continuing education needs. I'm really excited to be part of this team. I'm a registered nurse and have an MBA, and most recently was working with the Ontario College of Family Physicians. So I've spent my health and healthcare, and looking forward now to working with dentists. Thank you.
Susan, and last but not least, our new Director of Communications, Leslie Byrne.
Thank you, Council. It's just delightful to meet you today. I'm Leslie Byrne, as Dan and Sandy mentioned. I come to you with about 20 years of experience in communications through the Ontario broader public sector, and a parallel volunteer career in healthcare, on healthcare boards at Women's College Hospital and at Kensington Health. This is my 3-week anniversary. It's been an incredible 3 weeks so far. I've learned a ton and been privileged to work with some incredible staff people. I've really appreciated this morning your comments and particularly around communications, around fees, and I'm listening very carefully, and thank you for having me.
Thanks, Leslie. And just before I turn it back over to Hannah, I would just like to say that all three have hit the ground running, and they're approaching any challenge, seeing all of the opportunities in those challenges, and all of the ways in which this college can move forward and achieve its goals and fulfill its responsibilities. So thanks to all three for appearing and saying hello, and I'll turn it back to you, Hannah.
Thanks, Dan. Always great to see new faces, and welcome Danielle, Susan, and Leslie. Council, as you can see, if you've been checking your agenda, we have made a sizable impact on what was a full day and what will still continue to be a full day. But at this point in time, I am going to break for lunch. We will reconvene at 1 o'clock to start with item 14 on the agenda. Just a reminder to Council to please turn off your videos and mute your microphones until we arrive until we reconvene for a 1 o'clock start. And for those of you watching today's meeting on YouTube, we will be stopping the live stream for lunch, but will resume just prior to 1 p.m. So good lunch to everyone, and we will see you at 1 o'clock. Thank you. Welcome back, Council. Our next item on the agenda is item number 14, which is the audited financial statements and the appointment of an auditor. This item is for Council's decision. The information or the materials that you will require for this are on pages 192 to 232 of your package. Mark Eckler, Chair of the Audit Committee, will offer some comments. Kelly Tripp, our Controller, will then provide Council with highlights of the 2021 audited financial statements. And Mark, I'm going to turn it over to you now, please.
Hanno, once again, thank you. I'm pleased to bring you the audit report of the audited financial statements under the agenda number 14. I'd like to thank my colleagues of the committee, Rod, Amelia, and Sandy, and the members of the FP&A committee who participated in the discussions and for their commitment. That's to you, Jamie, Ben, and Peter. The work of the audit committee could not be accomplished without the extraordinary help of Jeff, Kelly, and Sharon. On behalf of both committees, I'd like to thank you. A primary focus of the audit committee is the external audit of the college and reviewing the audited financial statements to ensure that they are reasonable and can be recommended to council. 2 sets of audited financial statements are prepared for the college. The Rcdso financial statements, which you'll find in Appendix B, and the fund financial statements of the Rcdso pension fund, which you'll find in Appendix C. Motions for approval of each set out financial statements are included in the BN. Any detailed financial commentary has been provided in Appendix A, which provides context for the numbers in the audited financial statements. Our audit firm, Tinkman LLP, continues to be thorough and well organized, and the committee recommended that they be appointed again for the 2022 audit. A motion to this recommendation is also included. The role of the external auditor is to provide an opinion of the financial statements, to ensure there are no significant deficiencies, and review that the appropriate internal controls are in place and operating effectively. The auditor has issued an unqualified, or what we'll call clean audit opinion once again, indicating there is reasonable assurance that there are no material misstatements. The audit partner and audit manager from Tinkman attended the May meeting and presented their report on the 2021 audit. In the report, they explained that their independence standards, the steps they undertook in the audit process, and the audit risks they focused on. The committee also had an opportunity to meet with the audit partner and the audit manager from Tinkman in an in-camera session without the staff present, and no issues of concern were identified. At this time, I'll ask Kelly Tripp to make some brief comments on the highlights from the financial statements, and we'll be pleased to take any questions after.
Good afternoon. Thank you, Mark, for the introduction. As Mark mentioned, we are recommending 2 sets of financial statements. I will share a few brief highlights of the statements. However, I did prepare a detailed commentary report, as Mark mentioned, in Appendix A or on pages 194 to 201 of the package, to provide additional detail on the numbers in the financial statements and variances from the prior year. I will not be going through the full report, but will provide a few high-level comments. As Mark mentioned, we have an unqualified or clean audit opinion as indicated in the auditor's report on pages 204 and 220, which is what we want for both sets of statements. On page 206 and 207, you will find the statement of financial position and statement of operations, which are the heart of the financial statements and are taken together to inform on the financial state of the college. We ended the year with a deficit of close to 1.9 million, which is 2.5 million below budget. The deficit was largely driven by the PLP loss provision, as mentioned earlier, and is up over 40% over last year's provision. This was partially offset by exceptional investment income returns and a change in our investment policy. These two items provided savings or an offset in excess of $1 million, or as you would be able to calculate, the deficit would have been much larger without these two items. At this time, we do not have any cash flow issues. However, we cannot continue to sustain deficits year after year. The continued deficits do not allow the college to fund the operating reserve as required by CPMF, and which has a current shortfall of $5.1 million. I will stop there on the college statements and comment briefly on the second set of statements, which are the pension fund statements found on pages 218 to 232. The pension plan statements are prepared in a prescribed format and are required under the reporting regulations of the Pension Benefits Act. They are reported to FSRA, which is the Financial Services Regulatory Authority of Ontario, the provincial pension governance agency. These statements should not be used to evaluate the pension plan's performance, as the actuarial liabilities are excluded. The pension plan is correctly reflected in the college's financial statements. It should be noted this year, we revised language in these statements to be gender neutral as part of the college's commitment to EDI. As Mark mentioned, there are motions to reappoint the auditors and approve both sets of financial statements. That concludes my report, and I would be pleased to address any questions.
Thank you, Mark and Kelly. At this point in time, I will look to see if any members of council have a question for either Mark or Kelly. Seeing none, could I ask then that motion 8A be projected on the screen, please? And council, for your consideration, motion 8A is that council approves the December 31st, 2021 Rcdso audited financial statements as presented, and that the president be asked to sign an official copy on behalf of council. So if I could have a mover for that, please. Moved by Mark Trudell, seconded by Brian Smith. All those in favor? Opposed? Abstentions? Motion carried. Thank you. I think now we're moving on to motion 8B, if that could be projected on the screen, please. And the second motion on this matter is that council approves the December 31st, 2021 audited financial statements of the Rcdso pension fund as presented, and that the president be asked to sign an official copy on behalf of council. And I'm looking for a mover for this as well. Jamie moved and seconded by David Bishop. All those in favor? Opposed? Abstentions? And that motion is carried. Thank you. And the final motion on this agenda item is motion 8C, and that reads that council approves the appointment of Trinkum LLP to conduct the Rcdso audit and the Rcdso pension fund audit for the year 2022. And again, I'm looking for a mover.
Yeah, I will move.
Moved by Mark, seconded by Osama. All those in favor? Opposed? Abstentions? And that motion is carried. Thank you. Moving on to item number 15 on the agenda, services provided by external auditors policy. This item is for decision, and the materials around this item you will find at pages 233 to 238 of your package. And I'm going to turn it over to Jeff again, who will walk council through this draft policy. Jeff?
Thanks, Mano. I'll just provide some brief comments about all the information in the BN. So engaging our external auditors for non-audited services has always been referred to in the terms of reference for the audit committee as listed in the bylaws. So we thought it would be a good idea to formalize that into a policy to provide the audit committee clarification on what services may be performed by the auditors and which ones may not. So the audit committee does pre-approve the fee for the audit, but we may have reason to use the auditors for other work. So for this work, we've added a dollar limit where audit committee pre-approval is not required. So that would allow Dan or myself to engage them for non-audited services. And we would definitely report back to the audit committee at their next meeting. So this way the work is not slowed down and we're in compliance with the bylaws and the policy. So those are my comments, Anna.
Thank you. And we do have a motion associated with that. But first of all, I will ask, does anyone have any questions for Jeff at this point in time? Seeing none, could I have motion number 9 put on the screen, please? And council, for your consideration, motion number 9 is that council approves the services provided by external auditors policy. So if I could have a mover for that, please. Moved by Mark, seconded by Nancy. All those in favor? Opposed? Abstentions? And that motion is carried. Thank you. Moving on to item number 16, pension plan text revisions. This is proposed revisions to the language in the Rcdso's pension plan to ensure the college is using gender neutral language. This work is part of a broader college strategy to revise policies and letters to ensure that we're using gender neutral language. It aligns with the college's commitment to equity, diversity, and inclusion. The materials that speak to this item on the agenda will be found in your packages from pages 239 to 305. And Jeff, I'm going to turn it over to you again to provide highlights to the council, please.
Thank you. So I will probably repeat most of what you just said as introduction, but equity, diversity, and inclusion is definitely a priority for the college. And one of the ways we support this is to ensure our internal and external documentation respects gender diversity. And that was really the driver for revisions to this document. So the pension plan text is a formal regulatory document that defines the benefits and administration rules of a registered pension plan. And that is filed with the regulators. So it's filed with FSRA. The text was last updated 3 years ago, and the pension committee was presented with recommended updates to the text at its last meeting. 1, to incorporate gender neutral language. 2, to incorporate changes to the plan made 3 years ago, but not yet reflected. And 3, to add legislative changes since the text was last updated. So the document was originally drafted in masculine coded language with more than 100 masculine pronouns. So we fixed all that, and respecting gender diversity supports colleges' continued work in EDI. And as we update documents, we're always trying to incorporate an EDI lens to promote an inclusive work culture. So those are my comments, Manuel.
Thank you very much, Jeff. Any questions for Jeff before we entertain the motion? Seeing none, could I have motion number 10 on the screen, please? And for your consideration, council, the motion is that council approves the pension plan text as amended. So I'm looking for a mover, please. Moved by Jamie, seconded by Nancy. All those in favor? Opposed? Abstentions? And that motion is carried. Thank you very much. So at this point in time, we're going to move to item number 17 on the agenda. And this is an opportunity for chairs of committees just to provide a very brief highlight to their report and if needed or necessary, to entertain a few questions based on those highlights. So the way this will operate is that the reports are on pages 306 to 336 of your package. The reports are for information. And how we're going to work this is I'm going to invite the chairs of each committee to offer just a brief highlight or overview of their respective report. If anyone on council has any questions, we'll entertain them at the time, so report by report. So I'm not asking that you save questions until the end. In order to facilitate our time commitment, though, I'm going to allot between 2 and no more than 3 minutes per report. Don't feel you need to use all 3 minutes if you don't feel you need to, but that time will be set aside should you do so. I'm going to go down the list alphabetically, and I'm going to start with Dr. Mark Eckler and have him provide some highlights, if he chooses to do so, with the audit committee report. So Mark.
Well, I want to thank the team for getting an excellent, very succinct synopsis and report prepared for everyone. Jeff, I, or Kelly will be happy to enter any questions on this, but what was already alluded to is the audit committee and the FP&A committee have been doing some meetings together or sitting on each other. We're going to do this again in the fall and potentially look to formalize amalgamation. We'll be happy to enter any questions at this point.
Thank you. Any questions for Mark about the audit committee report? Okay, thank you. Seeing none, I'm going to move next to the discipline committee report to Dr. Richard Hunter, please.
Thank you, Hannah. The report has been provided to council in the materials, and I'm happy to respond to any questions. But first, let me discuss just a few highlights. I'd like to begin by, on behalf of the whole discipline committee, I'd like to thank Jillian Slaughter, Director of PCRA, and Susan Dick, the hearings administrator, and all the staff behind the scenes at PCR for their dedication and hard work. Their diligence allows our committee to function seamlessly. In the graph labeled hearings in my report, you can see the significant number of referrals to discipline in 2021. Presumably, the previous 2 years were outliers. A low number of referrals to discipline in 2019 in the pandemic and 2020 resulted in the low number of hearings. When dental offices reopened, there was a surge in case referrals, which we expect to last into 2022 and 2023. It's like the pig and the python. It will take some time for the backlog of cases to work its way through the system. In 2021, there were 14 discipline hearings held, more than the previous 2 years. There were 5 revocations in 2021, the highest number in 5 years. A breakdown of the type of professional misconduct and the penalties imposed are included at the end of the report. I'm happy to entertain any questions if there are any.
Thank you. Any questions for Richard about his report? Thank you. Seeing none, I'm going to move next to the executive committee report and Dr. Sandy Venditti.
Thank you, Hannah. First, I'd like to thank the members of the committee. We often meet on very short notice, and I always thank you very much for taking the time to be there. The report is pretty much self-explanatory, but I would be happy to answer any question if there are any.
Thank you. Any questions for Sandy? I'm not seeing any, so at this point in time, I'm going to move to the Finance, Property, and Administrative Committee report and the chair, Dr. Ben Lin.
Thank you, Hanno. I'd like to thank the other members of my committee, the FPA committee, as well as the audit committee for sitting in and providing insight to our combined meetings, which will continue in the future. I also like to thank Jeff, Kelly, Sharon, and the staff of the finance department again for providing everything. So the report has been provided to council and the materials on page 314, and I'm happy to respond to any questions. council may have. Thank you.
Thank you. Any questions for Ben? Thank you. I'm not seeing any, so we'll move next to the Fitness to Practice Committee report and Dr. Peter Deline. Peter?
Thank you, Hanno. Just a quick comment. Thank you very much to all those who let their name stand for this committee. It hasn't been the busiest committee over the last few years, but we feel a bit like the Maytag repairman at times. But we stand ready to go at any time, whenever they call. So the report has been provided to council in the materials. If you have any questions, I'd be happy to answer them. Thanks.
I'm not seeing any, Peter, although there may be a few people not understanding what the Maytag accountant reference was, but those of us of a certain generation understood totally what you were saying. Next item on the report of the committees to report on is the ICRC report, and that's Dr. Jack Wasserman.
Thank you, Hanno. And the report's in front of you. And yes, I've got enough gray hair to remember the Maytag repairman. I want to first thank the members of the ICRC for their tremendous effort. They participated in over 150 panel meetings, the most ever, and the agendas were very, very fulsome. And a special thanks to Jillian Slaughter and the rest of the staff for putting it all together and helping all the innovations. This was a very productive year for the ICRC. We took several steps to deal with the backlog of the investigations. There are several process improvements that were made in the report, examples of which are the record of investigation and the confirmation of complainants' concerns, and you'll see that in the report. The ICRC had a near parity in the number of complaints received and outcomes issued, approximately 550 in total. The majority of the ICRC outcomes resulted in no action or low risk outcomes, such as, for instance, advice or remedial agreements. And just under 3% of the cases were referred to the Disciplines Committee. Thank you, Richard. I'd be happy to take any questions about the committee report.
Thank you, Jack. Any questions about this report? Seeing none, I'll move on to the Patient Relations Committee report and Ms. Vivian Hu.
Thank you, Hanno. Hi, everyone. The report has been provided for you in the material. I'd like to thank everyone on our committee, Nancy DeCento, Brian Smith, who are on council here, Cassia Massered, and Sonica. And on the staff side, I'd like to also thank Andrea, Jillian, Wendy, and Victoria for their support. Really totally value their support and input. And I'll be happy to respond to any questions you may have.
Thank you, Vivian. Any questions about this report? Seeing none, I'll move on to the Pension Governance Committee report and Mr. Jamie Colliver. Jamie.
Good afternoon, Council. I too want to thank some staff members in particular. They've been named before. Jeff, Sharon, for sure, with all the material she has to put together. Kelly for all the work on the financials. And Joe Donahue, a name not mentioned as yet, but Joe is responsible for the education sessions that are held for pension fund education to the DC members. The report is on, also to my fellow council or committee members, Drs. Diddie, Eckler, and Hunter, and of course, Dan Faulkner, all of whom, by the way, are excellent committee members. They ask challenging questions, and I think we have very productive dialogues at the committee level. A couple of things I do want to mention, and I'm suggesting that you may have questions regarding, the markets right now. Well, the committee approved a while ago a de-risking strategy. It's called a dynamic de-risking strategy. So thankfully, our advisors did, in fact, alter the investment plan to more of a de-risking profile, meaning that a lot of the equities that were in the pension plan were sold or were reallocated to different investments that are slightly more non-correlated to the markets. So the pension plan is in a surplus, and that's a good thing. So I'm happy to take any questions. And I thank you for your time.
Thank you. Any questions for Jamie? I don't see any, so we'll move on to the Professional Liability Program Committee report and Mr. Joseph Richards.
Thank you, Mr. Chair. I'm just grateful for this opportunity to provide this report. It's been a privilege to serve as chair of the committee for the past 3 years. It'll be 3 years in July. And just want to thank the other members of the committee, as well as the staff led by manager Alan LaChapelle for his insight, guidance, and expertise that he brings and in assisting the committee do its work. I would encourage you, as you look at this report, you will recall that around a year ago in May, there was a PowerPoint presentation. It's a helpful complement if you need a refresher on what PLP does and the role of PLP. A 30-page PowerPoint is a good reference point, and was provided to you about a year ago. Just one or perhaps 2 points to make. As you understand that the PLP principle is to defend defensible claims, to resolve and settle claims where there is a liability. And you can see that, for instance, if you just look at the numbers for 2021, there are 1,678 incidents reported. And of those, 76 resulted in legal action. That means 95.5% of incidents do not proceed to legal action. And that is a testament to the sound preventative work that is done by PLP in trying to resolve cases and to minimize expenses as much as possible. You have the rest of the report there in front of you. Happy to entertain any questions that you may have. Thank you.
Thank you, Joseph. Any questions about this report? I do not see any, so we'll move on to the Quality Assurance Committee report and Dr. David Mock.
I keep forgetting to push the unmute. Like all the other chairs, I want to thank the committee for their diligence and attending, sometimes on short notice, urgent meetings. I also want to thank Joanne Loy, who keeps us functioning. Without her, I think our meetings would go on forever and we probably wouldn't accomplish much. Additionally, Andrea filled in when Mike retired and before Susan came, and I am really grateful because I was sure I was going to be in trouble. So thank you, Andrea. And I welcome Susan Taylor, our new director, who has come in under fire and looks like is going to just pick the ball up and run with it. You have the report, and it's been provided with your materials. As you know, our programs were relaunched in January after a pause because of COVID-19. The process for random selection of members to have their e-portfolios reviewed or to complete the PET were gradually increased and are now reaching pre-pandemic levels. We've developed new questions for the PET with a focus on the specialties of oral surgery and orthodontics, and as well caries, endodontics, and periodontics at the generalist level. Moving forward, we will continue and are continuing to improve these platforms. So I can pause here and take any questions if there are.
Thank you, David. Any questions? I don't see any. So the last committee report is the Registration Committee and Dr. Harinder Sandhu.
Thank you, Mr. Chairman. I want to thank my committee members, Nalin, Osama, and Christine, and also the staff, Hilary Bauer and Jan Scott. Without their help, we could not function and review all those cases. The report is in your binder. Please let me know if you have any questions. Thank you.
Thank you. Any questions for this report? Seeing none, I'd like to take the opportunity to thank all committee chairs for providing the highlights and for allowing again for opportunities for further questioning. we're going to move on to the next item on the agenda, which is item number 18, and it's other business. And at this point in time, it is a placeholder on the agenda, so it'll always be a part of the agenda in case there are items that needed to be moved, for example, from the consent agenda. Since nothing was moved from the consent agenda to this and nothing came up during the meeting, at this point in time, I'm just highlighting the fact that this position exists on the executive, rather on the agenda, but we're moving on from here. Item number 19 now is just a reminder of the next council meeting. It will actually take place on September 15th, 2022. And I know there are a number of people on this Zoom link, like myself, who have never actually met any people that we've interacted with in the flesh. So this will be an opportunity for some of us to actually see one another. And for those of you who are wondering if I'm really 6'4", you will be able to answer that question come September. But I wouldn't be betting big bucks on it if I were you. So our next meeting will be on September 15th, 2022, in person at Vantage Venues, which is located at 150 King Street West in Toronto. It's also an opportunity for the meeting. The meeting will be live streamed, so it's an opportunity for us to interact in person, but still have the ability or the possibility for part of the meeting to be live streamed. And Dan, I see your hand up, so I'm going to turn it over to you now, please.
Thanks, Hanno. I just wanted to mention to council that we're also planning a dinner the night before. So we'll get lots of details out to you well in advance. And we're really looking forward to the venue. I hear it's quite nice, and they've got the kind of technology that we need to host a hybrid meeting, and the price was right. And I know some other colleges that have used it as well. So like Hanno said, I am very much looking forward to meeting all of you in person, and we'll plan for a dinner the night before and the meeting on the 15th.
Thank you, Dan. And we are going to move on to the next item, which is moving into our in-camera session. But before we do that, Dan, I'm going to ask you, and I don't know if you're the right person to ask, and you can send it over to someone else if not. In light of the time that we're at, do we need to have a break? Like if we did a 5-minute break, does that allow staff to sort of, create the link that we need or the room that we need? Or could we move directly from this into the in-camera session without having a break?
So I think you're right. The only break we would need is to ensure that the technology works, and I would leave that to Angelo or Aldwin to advise us on that. But otherwise, I think we'll be able to conduct the in-camera meeting very quickly as well. So there's no need for a long break.
Okay, so actually then I will look to both either Angelo or Aldwin to see, like if I just do a 5-minute break, will that allow you to do your magic so that when we come back, it's just in camera?
Yes, that should be enough time for us to get everything ready.
Perfect. Thank you so much. So in a moment, we will be taking that 5-minute break. We will then move to our in-camera session. We will come back out of the in-camera session merely to have the motion to adjourn the meeting. But before I entertain the motion for that, I would like just to take this opportunity on behalf of everyone involved and myself personally. This is my fourth interaction with you as a council. I've really enjoyed my interaction with you all. I want to express my personal thanks and gratitude to the staff, who is just incredibly professional and incredibly supportive, answers all your questions, in many instances answers them before you even know it's a question that you need answered. I would like to take an opportunity to thank council members as well for the work that you do in coming prepared, for the kind of conversation that we engage in because of that work that you have done. And I think you should all be very pleased and proud with what we have accomplished at this meeting today. So for the in-camera session, there will just be council members, Alan Bromstein and the registrar. If we could just put the motion on the screen, please, to move in camera. Thank you. And that's motion 11, that council exclude the public from the meeting pursuant to clause 7, sub 2, sub D of the Health Professionals Procedural Code of the Regulated Health Professions Act 1991, as personnel matters will be discussed. So could I have a mover for that, please? Moved by Vivian, seconded by Brian. All those in favor? Opposed? Abstentions? And that motion is carried. Thank you, Council. We will just take a 5-minute break. So actually, it's 1:35 in my computer. So at 1:40, we will reconvene here and we will go into our in-camera session. And for those in the public who have been observing, thank you for your attendance. And I wish you all a good week and a good weekend.